So I already recorded a video like this, but I realized that I was coming from a place of reactiveness, not like groundedness. And this is in relation to employment and being a targeted person. I really hope one day I don't have to talk about this shit ever again in my life. I just came to more realizations though as to why I think this whole thing, like it snowballed into something way bigger than like, I'm gonna turn the air on for 2 seconds because it's really, it is very humid right now. Okay, maybe that's too loud. Is it too loud? I don't know. Actually, let me lower this. How do I have fans? Okay. As I was saying, yes, so unless people were playing mind games with me, but I came to the realization about things even more so recently as to why I think what's happening in my life is happening. But this video will be more specifically in regards to how to navigate targeting and like gang stalking, which first of all, by the way, for people that don't understand the term gang stalking, it's not like a gang like when you like see in the movies, like people are like with guns and things. It's not like that. It's like a strategic, like well coordinated community effort to psychologically degrade and undermine a specific individual so that they doubt their experiences and their reality. They learn to develop learned helplessness and mistrust in the world around them, and basically feel isolated and ostracized. It's a process. I'm pretty sure there has to be like a handbook or something that people follow, and I assume that they get trained on this stuff. It's really sad. And you ask yourself, why do people go to such lengths just to hyper focus on one person? I will never understand that as long as I live. You know, there's so many other things in life that are so much more meaningful and important than like creating this almost like game plan to take out one person. But I think the hope of it is basically, from what I understand, is to try to get someone to be mentally like hospitalized, like institutionalized, take themselves out, like literally off themselves, or unalive themselves, because the torture and the abuse is so bad that like they can't live anymore. They can't cope because it's horrible. Like, imagine you move somewhere and then the whole community basically gangs up on you, and they hear lies about you that aren't true, and then you have to like live with that every single day. People starting rumors about you, and then you try to get a job, you know, at a specific location, and then the forces that be that facilitate it will try to infiltrate said job. Or you try to go to therapy and they also try to infiltrate your therapy, because that's happened to me. Like, I recently, I'm not going to say specifically which service that I used for therapy, but there was a girl, and it could have been a coincidence. It could have been a total coincidence, but she seemed very, if I know how to assess behavior, verbal and nonverbal, and this girl seemed very just uncomfortable. Like, she was very, it was virtual support group for like, I don't know if it was for empaths or sensitive people, and or I don't know if it was for trauma or overcoming trauma or something, and her name was Ashley Coward, and it could be like, it could have been a coincidence, but I have on my shoulder the word fearless tattooed over here, and I've been having to be very fearless throughout this whole thing, because when I've said before on the channel that I've been like poisoned, drugged, scapegoated, lied about, and if you say, oh, where's the proof, I guarantee you there's like communications back and forth between, because I can sense it. I know that sounds really weird, but psychically, intuitively, I can sense it and I can feel it in my bones. I can feel it in my heart, you know? I've always been sensitive to energy, you know? So Yeah. But she, that was interesting. And she spent a good maybe 10 minutes of the therapy session for the entire support group talking about her headphones and how she couldn't hear. And I'm like, bro. I'm like, okay. I'm like, just. Because that's meant to trigger someone, right? Because you should show up prepared for your, for the group peer support session and not take time away because you can't put your headphones, like you couldn't fit, like it's just silly. Anyways, moving on. So this video is going to be specifically about how to cope through gang stalking or targeting within the workforce and how to navigate that experience, because I'm going to share my experience. It's not a pretty one. I'm going to forewarn people that it's not a pleasant story. So if trigger warning, if you're like going through this yourself, I'm sharing this experience because I'm hoping it can help other people. I'm willing to put my life at risk and put my life on the line and nearly almost die 1,000 deaths, which I feel like I've already suffered through numerous times, through wrongful poisoning, targeted, I guess, energy weapons is what they call it in the targeted community. You guys can believe that, I recently heard a guy on YouTube talking about all the targeted people are crazy and the gang stalking is not real and they're all delusional and schizophrenic. I'm like, bitch. I'm sorry to curse, but like, oh, sir, if I could psychoanalyze the fuck out of somebody, which is like, because and you could tell, you can just tell his essence, his vibration is so, I can feel, like, put it this way, when I watch AGT, America's Got Talent, and I listen to these amazing performers, I get goosebumps because their energy permeates through the screen and I could feel it. Like, I literally feel their energy through the screen. I know that sounds crazy, but this guy did not, I don't know if I should single him out. That would be really mean, because the quote, when they go low, you go high. I remind myself of this. I'm like, Ashley, when they go really low, do not stoop to their level. Do not do it. Because I could be that bitch, but I'm not going to be that bitch. I'm not going to do it. Keep my mouth shut. Because then that means I'm no better than the people doing it. Because then I become a perp. Because then I become a gang stalker, and me reacting to it in the way that they want, makes me just as vile and horrible as them, which I do not want to be. I pride myself on being a source of respite and like sunshine. I always say that when I meet people, I want to leave them better off than when I first met them. But anyways, this guy was like saying on YouTube how like, oh, and mind you, we're all saying the same thing. Like, we're all saying the same thing. We're all saying about the weird car phenomenon, the weird helicopter activity, all this stuff, and we're all trying to navigate it, but we're all being discredited because it's very plausible. Like, you can say, oh yeah, but that's not happening. You're just reading, you're hypervigilant and you're reading too much into it. Sure, but I don't think that's the case. Anyways, moving forward, how to navigate gang stalking in the workplace. So when I moved from Miami to Philadelphia, because not to say it started when I was a waitress, because I had a pretty solid team of individuals that I really liked working with back in Miami. I was a trainer as a server at the restaurant I worked at, and I loved what I did. I took that job very seriously. Like, I would be so thorough. I'm such a stickler when it comes to training people, because that's a reflection. First of all, when you're chosen to be a trainer for an organization, no matter what sector it is, that means that institution trusts you enough to be able to do a good job to prepare the candidates or prepare the people that they hired to do a job well done. That means that they trust your methodology so much that they're willing to have another person physically shadow you and watch you do your job effectively and competently. And they want that new hire to emulate and demonstrate that same level of knowledge and skill set, to develop that base, right? And so and mind you, it was at a restaurant, but I took restaurant world very seriously. Like, I was the kind of person that would take a new hire to the back walk-in freezer and be like, this is how they, according to shelf life, there's a certain way that you put meat and poultry in the back of a walk-in freezer, or like the vegetables, and you have to look at the expiration date, the dairy products, and you don't want to cross-contaminate things because for sanitation purposes, because you don't want to spread the transmission of like, E. coli or salmonella, things like that, because there's something called safe serve. I was certified in that, and I took it very, very seriously. So I felt very like honored to be able to be given that role, and everyone had to go through me first before they were set free to be on their own independently. And mind you, I was working with some very strong personalities who, like, two guys were from Albania, one guy was from Kazakhstan. His name was Tim. But I'm not gonna say last names. I don't even know his last name. Another one, a lot of people were from Venezuela, a lot of South American people. It was Miami, so it's a cultural melting pot. But anyways, in that role, like, I didn't really, I'm trying to think if it started there. I mean, I also worked amongst, ironically enough, funny enough, the people that I took care of were actually a majority worse. Like, I've taken care of SWAT people. I was the SWAT server. Like, I was the one, often when the SWAT people came, I was the SWAT server. I don't know why, it just turned out that way, because they would always come like at like 3 o'clock or 4 o'clock, and then we would do like shift change, and then I was the one to kind of finish up, and they would come in and they would get chicken parm and this and whatever. And I took care of police officers too. That's what's so ironic about this whole targeting gang stalking thing, that I'm just like, I'm so flabbergasted. I'm like, how is it that, like, I don't understand it. I don't get it. So anyways, from there, and then I moved to Philadelphia. I'm not going to go through the whole thing, but like, basically, it didn't happen within the workspace. I mean, no, I take it back. I worked at a hospital, my local pediatric hospital that I was rehired at, and I was basically almost like ousted from there. And I don't hold any animosity towards that facility, because I grew vertically within there. Like, I started off as a volunteer. I was a volunteer for like 4 years there, and then this was like 2010 to 2014, and then things kind of changed, like leadership changed, as do all organizations, and you come back and things are a little different. It also was an inopportune time, because I was going through this weird situation with stalking and hacking and all this BS. And so to come back and revisit the same space or the same company, but while experiencing the whole targeting phenomena, that was tricky to navigate. Whereas once I was like welcomed by certain individuals, unfortunately, I wasn't being treated nicely. And I basically was put on a performance improvement plan. And I explained my reasoning and my logic for certain things. I should mention that was kind of the first indication of like not so wrongful termination, but I was given a PIP, as they call it. I didn't know that, which, by the way, if anyone ever tries to present you with a PIP, please, for the love of God, because I didn't know what this was until I was presented with it. Like, I was like brought in by nursing administration, and they're like, this is, we were told this. And so just to explain, I was cited for, I don't even know if I should say this. It's actually pretty funny when I say it. I was cited for, I asked the person that was training me if she would like coffee, because I was being cross-trained. I was in the inpatient unit, on the neurology unit, and then I would go downstairs to the ER. And so I asked my preceptor, can I get coffee? I laugh now because when I think back, I'm just like, wow. And she said yes. And she said, no, you don't have to get me anything. Because me, I'm always thinking about the other person. I'm like, maybe she would like something because I don't want to sit there, and I was tired. And, inpatient life as a child life specialist is very different from outpatient life. It's very like, it's a lot slower paced. There's more complex cases depending if you work in the ICU or not. But outpatient is very touch and go. There's no like, and you get that adrenaline rush. But so I was transitioning. I was going from inpatient to outpatient. And then I also had an incident where one of the nurses on my unit that I was getting oriented to and trying to establish rapport with, which was my primary unit. Because the other one for the ER, I was basically like, not a float, but like a ancillary form of support in that role. Like they had the two primary child life specialists on that unit. And then I was, I kind of came in like staff relief almost, basically. Not so much like a team, but like I was there to support them if they needed like help if it got busy, because I was trained in, again, the years before in inpatient and outpatient care. And to be cross-trained as a child life specialist, that's a pretty big deal, because usually you stick to one niche, and if you can float and be able to adapt yourself like a chameleon between different units, like that's a gift. And I really, now looking back, I go, I am a little bit more talented than I thought. I don't give myself enough credit for that. But I was cited for asking if my preceptor wanted coffee. And then a nurse called me on my direct line asking, where are the chewy tubes? So if you don't know what chewy tube is, patients that are on the spectrum, they need sensory input. A lot of the times it's an oral fixation thing, where they need, it's a sensory input. So it's something called stimming, stimming. So when you, it's a form of self-soothing and sensory regulation. Or like when I don't know if I mentioned this before, like when you put your hands over your head, like proprioception, when you're trying to ground yourself and like, give yourself, just self-soothing and regulating of the nervous system. And that's with like deep DPT, deep pressure therapy, using, that's why people, when they, like, if you have a weighted blanket, it's very comfortable to like have that sense of security and comfort with that extra weight. So this patient wanted a chewy tube, and it's very simple. It's just a little rubber thing that looks like a letter T, and for them to chew on. And so I asked my preceptor, can I go ahead, and while I was downstairs in the ER, and I said, can I go ahead and show her where that is? And she said yes. And I was being trained, so I got the A-OK to go back upstairs to my floor. I think it was I forgot what floor, because 4th floor was NICU, 5T, so I was on 5, so 5th floor. And so I went up there, and then I very quick just gave it to the nurse, came back down. I was cited for that, for bringing a chewy tube to a patient, and I was told, there's other people that were available that could have done that. And I go, no, there wasn't, because this was during the evening time, around 6 to 7 p.m., and everyone had already gone for the evening. So it was just me and the other girl that was the preceptor. So that, and then I also was cited for, what was it? I don't know if it was overtime, if I stayed over. It was basically, people were finding reasons to try to get me fired, I guess, or something like that. And it was really, and it's funny because my supervisor at the time, she went on vacation while this was happening. So it was another individual who kind of was the, not interim supervisor, but my indirect supervisor. So it went from being, I was very welcomed in that environment, even, down to yoga. I was still certified in yoga. And in the interview, I wish I could have recorded it, in the interview for this job at the hospital that I was at, that I got rehired at. In the interview, I was asked, how do you incorporate yoga into your child life practice? Can you cite examples? And I cited examples. That very same thing I got cited for doing with a patient. One supervisor said it was okay. the other supervisor said that it wasn't. And I didn't do anything super avant-garde. I basically, so as a child life specialist, the whole goal is to mitigate the stress and anxiety brought on by hospitalization, right? It's to help a patient master or cope through traumatic situations. And you do that by offering opportunities for therapeutic recreation, which is therapeutic play, normalization of the hospital experience, so bringing in what is normal and familiar to the child inside to the hospital, so using their favorite comfort toy, bringing in pictures of family, having them do their favorite activities. Like if a child loves soccer, let's say they love Neymar or Lionel Messi or something, you would put a poster of Lionel Messi in his room if he loves soccer. You would, let's say they love basketball, and you would get a toy. Let's say they're bedridden, right? Let's say they were bedbound and they can't ambulate from the lower extremities down. You would get from a child life specialist perspective, you would get like maybe a basketball hoop so they can focus on upper extremity mobility, right? To do that and to give them a form of distraction. So you're normalizing the hospital experience through play. So that's just a little tidbit about what a child life specialist does. So when I got certified in yoga, I did that because I wanted to have something in my arsenal, in my toolbox, to be able to utilize with patients, whether it was from utilizing like visualization techniques or deep breathing techniques or mindfulness meditation. And so I got certified in that. And for patients that were able to ambulate, which means be mobile and move around, right, without restriction, I did things like, tree pose, which is like standing, and I would adjust it and modify it. Obviously, I'm not going to like do full on, like, let me bring if tree pose, it's Vikrasana. You bring your foot to the inner thigh and you press it against it and you stand tall. And I would use these allegories or these references, like standing strong like a tree, right? You go through hard times, and though the tree sways with the wind, it still stands deeply rooted and firm in the ground. So, or lion pose. Lion pose is supposed to enact bravery. It's supposed to correspond to the solar plexus chakra, which governs confidence, right? So, like, I worked with a patient, he was like 8 years old, I think, on the neurology floor, and he was being assessed for, I don't know if it was seizures or something. It was, I don't know, but he ended up getting diagnosed with ODD, oppositional defiant disorder. And so I used Inside Out, the movie Inside Out with the little characters. If you don't know that movie, then you can go, it's a Pixar movie. But I used Inside Out, my little figurines. I used a dry erase whiteboard, and I used yoga to help teach him coping techniques to help him cope through his emotions and to kind of be more medically compliant, because I don't know if he was taking his medication, and his grandmother was his sole caretaker, so his parents really weren't that present in his hospitalization. So I established kind of this game plan or coping plan for him. And I remember I had my supervisor sit in and watch it, and we did a whole like yogas, like I talked about lion pose, and I talked about tree pose, and warrior, be strong like a warrior, right? Be like a ninja. I didn't say warrior, I did warrior 1, 2, and 3. And so I figured out a way to weave that into, now mind you, he didn't really have any like super impending, dire, critical things. I did work with a patient who was post-op a week from having, I don't know if he had a tumor resected in the back of his brain. So he wasn't transferred to the oncology floor yet, so he stayed on my floor. I don't know if I did a teaching for him about, I may have done a pre-op teaching for him. I don't remember, but he had a sibling. He was super close to his family, but he was about post-op a week. He was able to move about the unit. I made the medical assessment and the judgment given his medical status, his alertness, his ability to respond to verbal instruction and commands, his ability to ambulate, obviously, and his reflexes. So, and I'm not a doctor, but like I literally went through like everything. I assessed verbal, nonverbal, I sat with him, I spoke to his parents, I developed a really good kinship or a rapport with his family. And I said to myself, maybe he would be a good candidate to do like some yoga, but like very easy, mild yoga. And so I brought the activity assistant with me that was assigned at the time that was working with us. And I said, because in my mind, I need an extra pair of eyes and I want to have extra supervision. So I brought his sibling. We did a sibling session where we did, I believe we made bracelets, like strength bracelets, affirmation bracelets. So first I brought him to the family center downstairs. The parents approved of it. He didn't walk there. We used a wagon, or we used like these little cars that are designated for patients to use. And I can't recall if he had his IV pole. I don't think he had his IV pole with him because he was disconnected from that. Because again, he was post-op. He was basically in recovery. And also the nurses gave him the okay. The charge nurse on the floor gave him an okay to be able to go. Because when you give the okay, you have to get infection protocol for infection control, risk quality, evaluation, things like that before you say, yeah, you can step off the unit and go walk around the hospital. So if the charge nurse of the unit said it was okay, she trusted me enough and the other child life activity assistant to go and do this. So we walked together to, the family center. And and I had the yoga mats, and I made sure I chose, I think it was tree pose, and we did. And then I said, you know what, let's have him sit down, because at the end of the day, I don't want to risk him falling or anything like that. So I modified it very easily to like have him balance like maybe on the with one foot like just slightly off the floor, but not like completely off, because I was watching him and I was certified in yoga at the time. So we did that, and I'm trying to remember what other poses, probably lion pose, probably similar to what the other patient did. And then we sat on the floor on the yoga mats and we made bracelets. Meanwhile, the activity assistant that I had was texting the whole time. I didn't say anything to her about it, but I needed her to be focused, and I'm not her boss, so anyways. So there's a reason why I say this story, because it kind of speaks to the whole, targeting thing, the wrongful targeting. So I was cited for that. I was told that I shouldn't have been doing yoga, but my other supervisor said that I was okay to do yoga. In fact, in the child life research bulletin, when I was very much, involved in, staying on top of the latest literature and evidence-based practice in the field, there was actually research done on the efficacy of, yogic interventions and mindfulness and relaxation. So people were traversing that landscape in respect to psychosocial care and support in pediatrics. So I was just like so baffled and like taken aback when I was just brought into that. And then the other thing I was cited for, or speculated, was that I didn't care about the general welfare interests of patients, because so in child life, there's something called one voice. When you're doing a procedure, or when a nurse is present in the room or a doctor's present in the room, it can be very, very overwhelming for a patient, because first of all, they have to deal with people, different smells, different sights, different sounds, people in white coats. There's actually something called white coat syndrome, where children get really afraid of being bombarded with all of this stimuli that is very overstimulating. And so when you're laying down, even as an adult, if you're laying supine on your back, which prone is when you're on your belly, supine is when you're on your back and you're looking up, right? And you see, right? Can you imagine like having someone come with a needle or an injection? Like you feel so vulnerable and helpless. So there's different things in child life called like comfort positioning, where it causes the least amount of aversive stress and stimulation for a patient. So you position a patient in a way where you're providing nurturing support for them, so that they are not so afraid of a procedure happening or things like that. So In this instance, my preceptor for the emergency department, I'm not going to mention her name just because I don't want to, and I don't believe in bashing people. I'm citing specific incidences so people can understand how targeting works within the workplace, right? And there's more to come with that, so people can be well prepared. Because if I can help prepare people, later on, we can have proof and evidence. Because, like my mom always likes to say, intuition won't hold up in a court of law. So, moving forward. In this instance, there was an LPN who I actually knew from years ago when I first worked in the ER. And he, with the child life specialist, it was him who was the holder, because some patients are not medically compliant, so they have to have a holder just in case, like they have to restrict the patient's mobility, because the patient could be a threat to themselves if they're flailing their arms and you have medical instruments and things, like it could be very dangerous. So but typically as a child life specialist, you want to prevent that, because if you can actually teach a patient what's going to happen prior to them experiencing it, it actually leads to more successful outcomes, and it helps reduce any psychological stress or sequelae that they may experience later on thereafter. So I was very big on preparing patients for procedures and doing like medical play and having them touch different, the IV catheter without the needle, like with the needle retracted, the tourniquet, and I would like to think I was pretty successful, because I didn't they barely needed a holder. When I was in the room, because I coached them, I prepped them. And that's the beauty of child life therapy, is that, especially for procedures, and this is what frustrates me, because I loved what I did, and not to say I was excellent at it, but I really learned the craft really well. And so to kind of miss out on that and lose it because of targeting, it's really sad. Anyways, so it was the LPN, the child life specialist, that was my preceptor, and another nurse, and I think the mom as well. So you had 4 people, 2 people on the right side of the bed, 2 people on the left side of the bed. I did not need to be another individual at the head of the bed, staring at a kid like this, watching it. I've seen enough IV starts to go down, I've seen it. I remember how it goes. And in child life, there's this thing called one voice. So it's this idea that there's one person who is basically like the MC, the master of ceremonies, right? To kind of explain and guide the encounter and the situation, to explain step-by-step procedurally what's going on. So then that way, a child can focus on that person's voice, whether it's the parent's voice, a nurse's voice, or a child life specialist's voice. Because if you have all these people who are crowding around you and bombarding you, you're going to be very overwhelmed and overstimulated. It's just any kid. If I was a 12-year-old, 14-year-old kid and I was in the hospital, and I'd be so overwhelmed. So it's this idea of designating one point person to be able to speak on behalf of all the other healthcare professionals in the room in an effort to reduce the psychological stress and anxiety that could be brought on by a certain procedure or the hospitalization. So I made the assessment as the person being trained to sit. I sat in a chair in the room, and it was also very close to the time that I had to be, I'm going to say dismissed, but the time that I had to clock out, because I was an hourly employee at the time. And so I was being very cognizant and mindful of the time, and I'm okay, because I already was told, make sure, because I stayed overtime a few times, and they were very good about adjusting. If you stayed over, then you would just shave off time. You would either come in later or you would leave earlier. And that's also time management, because, but when you're working outpatient, it's a little bit harder to navigate that, because outpatient is such a, you never know. It's like a box of chocolates. You never know what you're going to get, right? So, you can plan as much as you can, and nurses know this too, you can plan as much as you can to, I remember very distinctly, I would go, okay, so if it's a laceration repair, they need to they're going to be assessed, they need the nurse to do their vitals, they're going to be triaged, and they're going to be placed into a room, or they go back to the waiting room, they come back, and then they get placed into an actual room in the ER, and then they have to be assessed by the provider or the PA or a doctor assigns themselves to the room. Then they have to be evaluated by said doctor. The doctor chooses the game plan. Let's say they need stitches, right? Let's say it's a laceration repair to the orbital area, right, to the eye. So they need to apply EMLA, right, which is a numbing cream to the forehead, and then they put a bandage, and then that has to sit for 20-30 minutes to take effect. The area gets blanched, and then that gives me a time frame and a window to go in there and, coach the teach. Well, also you have to figure out what the plan is, because some doctors would use literally, like, they would give him midazolam intranasally or, by PO, by mouth. And so you would kind of have to wait and see. And then I would go in there and assess, could this patient do well without being papoosed or wrapped up or in a burrito? Sometimes they wrap the kids up so they don't move around. But if the kid's old enough, you can teach them, or maybe they don't need to, it's just getting kind of cold, where you don't need to do all that stuff. So that's kind of the point of child life, is like, they would use our knowledge and expertise to say, hey, could this kid do well without sedation? Could they do well without any sort of Versed or midazolam to make them more sleepy and loopy or whatever, or less coherent, so they don't feel, they're not cognizant of the pain of whatever, Because when you get stitches, they inject lidocaine to numb the area, and then you're getting literally like a hook, with the proline and the stitch, all that stuff. So anyways, I was able to gauge, kind of depending on where someone was at in the, in their hospitalization, whether it was inpatient, outpatient, whatever. And so, with the ER specifically, it was a little bit harder to navigate that and to say, you can say all you want, okay, I'm going to leave at this time. It's harder. An outpatient child life specialist, if you're a child life, you understand what I mean. Radiology, they have earlier procedures. Radiology child life people get out at like 4 p.m. ER people get out at like sometimes 1 a.m. if you're in the later shift, which is what I did essentially. But anyways, going back to what I was saying, I was in this one instance with the IV start, I was being cognizant of the time, and I was like, I need to get the heck out of there, because I was like going to be overtime. So the girl thought I was being very lackadaisical, like I wasn't, the girl who was my preceptor, I think she thought that I wasn't invested, and that I think she thought I was like, I didn't care, or that since I already worked there, I was like a know-it-all and I didn't need to be trained, which is not true at all, at all. I was going through a lot at the time because of the whole targeting with the stalking and whatever, but I took it very seriously. Did I feel welcomed? I don't know. In that unit specific, I felt welcomed on my inpatient unit. The outpatient unit, unfortunately, women are very catty. We don't, and I've said this before on other videos on my channel, is that women don't celebrate other women. There's a song by Beyonce, and I mentioned it before, Flawless, where she inserted this part of a TED Talk that Chimamanda Ngozi, I can't pronounce her name. She said that women see each other as competitors for jobs and for men, and it's so ridiculous to me. Because the funny part is that I looked up to those women, the women who were training me. I thought the world of them. Like, I thought, man, they were so, I learned things from them that I hadn't applied when I was a child life specialist in the ER years before at that same hospital. And I was like, man, this girl can be a nurse. I was like, this girl knows her shit. I was like, she knows about the treatment plan, the trajectory of this, and she was looking at, looking into the medical history, and I was like, oh my god. I was like, and I didn't get jealous one bit. I was like, I need to sit by her and listen to her and learn from her. But little did I know that a week, 2 weeks later, I would be getting a PIP plan, and that I called her out and I said, I'm going to leave the hospital. I told her I'm leaving this position, and I really would have appreciated if you came to me first versus going to your supervisor, who she was friends with personally. And that was a conflict of interest. And I don't hold any animosity towards these people, but this is job security, folks. This is not something you play around with. That was my livelihood. I had goals to, you know, grow within that role. And because of, I don't know if it's favoritism, because the girl that was, I don't know if she's there anymore or works at the hospital, but they were friends, and this girl got promoted to being a supervisor. And so, and I didn't have any issues with this woman at all when I first got there. She wasn't my direct supervisor, but she was their supervisor. And it was almost like they were finding reasons to have me eliminate, you know, like, and I pleaded, you know, and it's funny, when I was brought into the office, like, and I spoke to them and I said, well, let me explain to you what I am working on my unit, and the things, the initiatives that I've done on the floor that I worked on. Let me talk to you about how welcoming and well received I am by the certain nurses that I work with on my primary unit. Because why is it that the nurses over here are telling me that they're super appreciative of my services there, but I go downstairs where there's 2 other women who were training me and I guess conspired together to try to oust me to get me fired? So then I took it upon myself and I started to look at other jobs, at other locations. I got 2 offers. One, I saw this recently in my Outlook inbox and I was like, man, I can't believe that I got almost hired there. I was so grateful. But I ultimately chose, there was a really well-renowned cancer center that I was going to say auditioned for, but I call everything an audition, because coming from the performing arts background, when I did like dance and ballet and all that stuff, I call everything an audition, even though it's not, but that's what I call it. So really world-renowned hospital in Texas. I don't know if it was in Dallas or Houston. And then there was and what it came down to ultimately was just Texas, you need a car. You know, it's a very car-dependent, car-centric state. And Philadelphia, it's very walkable. And I was like so elated and ecstatic that I got hired at one. It's so, and I'm not really into, you know, like, I'm not into the whole, you know, top 10, the top whatever things, you know, the hospital, but it was really like, it was a really cool moment to, like, you know, like, I didn't ever think I was good enough to work for these kind of organizations, and the fact that they deemed me a viable candidate, I was so grateful and so happy. And that's what, you know, I eventually did move to Philadelphia, and I can't really, it's funny because that was like one of the only areas in the hospital, like that hospital specifically, where, I mean, I didn't stay there long enough to, but like even in the beginning, my supervisor, she was a sweetheart. I remember when I got there, they had like a welcome party where they had a welcome breakfast, and they had like muffins, they had orange juice, they had all the child life people come and you know, introduce themselves to me, and I felt it was so foreign to me to feel welcomed in a team. And I get so frustrated looking back at it, because I was experiencing weird stuff in my building in Philadelphia that I was residing in, and because of that, it had a really strong impact on me being able to do an effective job at the hospital, because I was so preoccupied. And that's why I took it upon myself, and after 3 months I was like, because I was so distraught, my focus was all over the place. I was tied to my phone. I was angry all the time because of the hacking and stuff, and it was hard to prove. I ended up adopting Bonnie in January 2023, and I didn't really think about the repercussions of that, you know, and I love her. Like, I'm so grateful for this dog. You know, I tell myself, I go, was she worth, you know, like, because what happened was you couldn't really, like, leave campus. I mean, you could leave campus for your break if you wanted to, but they didn't really condone that. They didn't promote that. They wanted you to stay on campus to, in case of like an emergency, if there's another child life specialist that needed help. And so I don't have anything bad to say about that hospital. I just think the timing, and I got Bonnie because, funny enough, I wanted a guard dog, and she's like the most not guard dog ever. She's so playful and so like loving and nice, and I'm so happy that I got her. She's the light of my life, and I really get nervous about gangstalking and targeting and them poisoning her and stuff. She's sitting under the desk right now, if you want to see what that looks like. He's right there. He's sitting under the desk. So I can't really say that hospital did anything to sabotage me. Like honestly, they were like super nice. Like I remember when I was like charting and documenting things at the computer, like there were child life people who would like literally be like, no, take my computer, like here. I was like, how are you people so nice? I'm so not used to this. I was waiting for people to like do something, like I was waiting for like something bitchy to happen, because you have different women, right, all confined in the same space. But that's the beauty of like when you have a team, when you have people who are working towards a common goal and they put their egos aside, because that's what I've been wanting to find, is an organization that genuinely cares, like and that's one thing I will say too, is that if you're in healthcare, you understand what I mean. University affiliated hospitals are like the shit, excuse my language. And when I say this, I mean this in a way like, because when there's a focus on research and innovation, people are much more like, and then they get hired there because they're much more interested in like finding groundbreaking ways like to be innovative in healthcare, like versus a smaller hospital somewhere where maybe they don't get as much funding, but like it's just people's brains, their focus is different. They're more academically inclined. They're more willing to participate in things that could help kind of push the envelope, and try new ways to, even in the psychosocial landscape, in the psychological landscape, like it's not just the medical, it's people who are unabashedly unafraid to try new and creative, innovative ways to, offer healthcare. And that was very much aligned with who I am as a person. It was like a really good fit. And because of stupid targeting that was happening in my building and other weird stuff that was happening with my phone, I resigned. And because I told myself they deserve better than me, being so like hyper focused on hacking and targeting, because I was on my, like I wasn't I was not charting, like my focus was elsewhere, and I wasn't charting like on time for me. Like I know my standards, I hold myself to a high standard, and like I wasn't charting on time. I was more concerned about looking up stuff on like YouTube and listening to like card readings about what could happen in the future versus like focusing on the job. And that's when I knew, I was like, this is not fair to them. I was like, I worked with the other team of 3 other wonderful women, and I don't want to cry about it. It's frustrating. And it was such a different environment going from what I experienced back home from Miami to Philly. It is what it is, but I pride myself on the fact that I possess a vast amount of self-awareness, and I said to myself, I am not gonna, I want to be the best team player that I can be. And that's why I told myself I need time to recuperate and recover. And that's when I engaged in a lot of like self-care activities. I think I told my boss, I told her, I was like, I'm kind of interested in law school. I told her, I was like, oh my God, sometimes I'm like, my brain, I am Delulu. And I was like, and mind you, because I was near Penn State, I was near Jefferson Hospital, or all these like really I didn't know Penn State or UPenn, like those were Ivy League schools. And in my mind, I'm like, I want to go into law, because I was so angry about like what happened to me with my phone and stalking and hacking, that I was like, I'm, like Elle Woods and Legally Blonde, like, I'm going to law school. And it doesn't work like that. You need money, you need scholarships, you need to take the LSATs, you need, so I don't know. I just, to me, nothing is impossible, Like Audrey Hepburn says, even in the word impossible, it says possible. And I don't mean Kim Possible, like Ron Stoppable, Disney Channel. I mean, like, if you put your mind to something, I think it is possible. So, I left, that role, and that was when things started to go south, in the sense that finding work got really hard. I mean, I kind of started to go through my savings a little bit, because I had to dip into that because I wasn't working. And this was around, January 2023, but I adopted Bonnie. And I had money. I went to the background check. I went to Voorhees, New Jersey. Shout out to Animal Welfare Association. They were wonderful people. I forgot the name of the girl who helped me. I don't know if it was Amanda, but she was excellent. This girl was a brain of a person. Like, she knew everything about zoological studies and veterinary. Like, the girl could have been a veterinarian. Like, it was amazing. And I told her, I was like, you need to be promoted. I was like, how can I get you promoted? I told her that. I was like, how can I get you promoted? Because she knew everything about like animal behavior and animal care. And she helped me with Bonnie. That was the process I was trying to figure out. There was another dog named, I don't know if it was Scooter or what his name was, but he was so cute. Or Pete. No, it wasn't Scooter, it was Pete. I think his name was Petey or something, but he was so cute. It was like this cute little, like, he didn't look like Bonnie. He was smaller than Bonnie, but he was so alert and like, but he was too alert. And I think he would have been a good guard dog, but like, Bonnie ultimately like got my heart. And she's a little silly, but I love her so much. And unfortunately, to be able to take care of her while I was working at the hospital, that was a little bit, that was cumbersome, because I would have had to get off campus and like fed her while on break, and it would take about like, and I think I did it once where I went back home and like I got on the train or whatever, and then I, so because I was about 20 minutes away, I think, give or take, right? It's so weird when you talk about your life and the choices you could have made and stuff like that. And it's funny because my parents told me, they're like, you were supposed to wait for us to get a dog, we were gonna do it together. And I was like, because I was so scared of being alone at my apartment, because I was seeing a weird cast of characters in my building. Like, there was this one dude, I swear to God, I thought he was a trafficker. Like, he was in the elevator and he had like a Pitbull that almost bit me, and I reported that to the landlord of the building that I stayed at. And I said, there was a guy and he had this, like, I thought we're not supposed to have bully breeds, like a mix or whatever, but this was like a full-on Pitbull. And I was like, and I love dogs, and I was like, oh, you're so cute. And it was like, and like almost grabbed my hand. I'm like, oh my God. And he had these really tall dudes in the elevator. Like, they could have been basketball players, but they were not nice. Like, they gave me the weirdest look. And the guy's like, oh, where are you from? And I'm like, oh, I'm from Miami. And, I like to talk to everybody. So I was like, in the elevator, and he's like, oh, I just came back from Miami. I'm like, oh, really? I'm like, oh, that's so cool. And then he called the guys around him his boys. And his boys would always be around him, like, a lot. And, like, whenever I would show up somewhere, like, if I went to the basement to throw, like, trash out or whatever, he would be there. Like, big boxes and stuff, like, he would be wherever I was. It was very strange. He drove an Audi. I remember distinctly he had, like, an Audi R8 or something. Not the SUV. But, like, he had these glasses that changed colors that were rose-colored. I was like, I just got really weird vibes from him. So that was scary, But anyways, after that, I started to try to find, I wanted to work for Bright Horizons, which was a child care center. I met a really nice gentleman who was the recruiter for Bright Horizons. I went to a Jewish synagogue. That was cool. I went to a Jewish synagogue, and I don't know why. Lately, I've been so interested in learning about Jewish culture. I don't know why. Oh, no, because I have like 5% Ashkenazi Jewish heritage in me. So I've been really curious about. I'm such a nerd. Anyways, because I'm learning about like kosher foods and like, I thought a rabbi blessed foods that were like, I don't know how that works. I just think it's like, you know, I don't know. I hope I live till, because this is stupid targeting shit. I keep saying, I hope I live till my birthday. I hope I don't get murdered before then. I hope I don't get drugged and poisoned before this and this, because I'd really like to buy a menorah this year. Because Target had a really cute menorah last year, and it was like blue, and it had the little like candles or whatever. I don't know. I know, I'm sorry if you're Jewish, please, I have no disrespect for Jews. I like learning about different faiths, because out of respect for them, I just don't like being disrespectful to people of different faith. Anyways, I digress. What was I saying? So, the apartment, okay, so, this Jewish synagogue. So I remember I went to a career fair for Bright Horizons. I met a wonderful gentleman. He was so nice. And he's like, oh, we can get you good pay. And I was like, okay, let's do this. I don't know why. I think I was just so fed up with like the apartment situation. I was experiencing weird vapors and stuff in my apartment. So then I was like, okay, screw it. And then I went to move to... I went to go move to Virginia because my parents were moving to Virginia at the time. And I was like, oh, I want to be close to my parents. So I looked for hospitals in Virginia. And that one was not a fun experience. I was not treated very well over there. The supervisor was very nice. I maybe got like a week in at the job, and then when I got trained, I was very bright-eyed and bushy-tailed. I was so excited. The process to get there was hard too, like the background check. And I was like, maybe God is like giving me a sign, like this won't be the right fit for me. I should have heeded that. I really should have. There was another hospital, but I bombed the interview because I was so like distraught about other things. And it was in Wilmington, Delaware. It was Nemours, and I told like 100% I bombed that interview. It was a phone screen. I was like, forget. It was just bad. I'm trying to remember what happened after that. But eventually I did, I passed the background check. I did my fingerprints, all this stuff. They did the health evaluation. I got to, I'm not gonna say the name of the hospital, but I got to said hospital. And the girl who trained me, I don't know why, I don't know if I rub people the wrong way. I don't know. I really don't know. I try to, when I meet people, I try to be cordial. I try to be friendly and amicable and warm and not overly sweet, because people can tell, like people can tell if you're fake nice, people can tell. But when you're like nice from your heart out, that's palpable, right? I can tell when people are like not nice, And so I pride myself on just, whenever I start a new role, I try to be like a sponge, and I tell myself, I go, Ashley, you don't know it all. They know it. Like, you need to listen to them and sit next to them and absorb things as much as you can. So that was my focus, right? And so I met, and there were some nice women there that were like, one lady was really nice. She was the PICU child life specialist. Then I was assigned to radiology, right? I think it was a radiology child life specialist. That's what I was going to work. I was going to have really good hours. My preceptor, I'll never forget it. And this was the first and this might have just been not even targeting related, just like general like cattiness amongst women. But I said, I was like, they were talking about future opportunities for growth when we were sitting down in the orientation meeting in the playroom. And it was like, what did she say? She said something, and she's like, They mentioned practicums. So when you're a child life specialist, you have to go through an extensive training process. You have to do a child life practicum where you basically get like your introductory experience into the world of child life therapy. So you shadow a certified child life specialist on a unit for about 4 to 6 weeks, and you do that maybe once or twice a week, and for like 4 hours, more or less. And then, so I did my practicum in the emergency department, right? You do one outpatient and one inpatient. What did I do for inpatient practicum? I'm trying to remember, right? Because it was like, I don't know. I'm trying to remember what it was. I just remember doing the ER for my practicum. And, and so, and after that you do an internship, and then that's a longer one, and that's where you have more responsibilities, and then they shadow you and supervise you, and you do inpatient, outpatient. You get like it used to be 460 or 480 hours. Now it's 600-hour internship. So I was kind of grandfathered in where I did about, 500 something hours, because I was ambitious and I was like, I want more hours than 400 because I was like, I'm a go-getter. And I just wanted to learn as much as I could, right? The more exposure you have to a certain thing, the more you learn about it. So, so in that meeting at the job, at the hospital in Virginia, the girl goes, they were talking about practicums, and they're like, yeah, there's this, and then my preceptor's like, yeah, well, you're nowhere near that yet. And I'm like, I never said I was. I was like, and then she's like, you're nowhere near that. Like, you were just starting, you're not gonna be. And I was like, okay. I was like, thank you, understand. I was like, I was just, that is something that I aspire to mentor students and stuff. So then right after that, talk about karma, she spills her entire coffee on the floor, the whole thing, hot coffee. And I'm like, and I go to help her clean it up and stuff, because that's my heart. I'm not going to sit there and be like, karma's a bitch. But, I was just like, because I could be a bitch, but I don't stoop, when they go low, you go high. So I just, I was like, okay. And I was like, yeah, one day I would like to, that would be really nice if I could have a practicum student, but I'm not there yet. I was like, I just started this job and I'm not even interested in that, right now. So that was my first little ding, like, okay, I don't know how this is going to go kind of thing. And then the following few days after that, and I finally get to the radiology floor, one of the girls starts like stripping out of her clothes. She changes in the actual office. Like, she had to change into, like, I'm talking full on her bra, this, that. I mean, she could have gone to like the bathroom, and I was just like, to me, that was super unprofessional. I was just like, this is uncomfortable for me. That was like a sign right there. I was like, I don't know if this is going to work out. And then the third icing on the cake was when, and it was very strange because like I was experiencing weird stuff in every apartment I was going to, like literally weird vapors and like VOCs and chemical stuff that I tried to get an HVAC technician for back in Philadelphia, but they couldn't find anything. But I was getting weird air quality readings on my air quality meters that I had for COVID. And there's these things like with the air purifiers where they can sense dust and mold and like toxins in the air. And my devices would be like through the roof saying that like things were bad or whatever. So, the girls all of a sudden all put masks on, like, and we were in the office, like I didn't have a mask on, like the N95, like they all put masks on, and I was like, this is weird. And then one girl, like, she stretches, she's like, the air is so, like, very exaggerated. She's like, the air is so clean in here. Oh my God. And I'm like, what is this theatrics? Like, I was so taken aback. I'm like, what is going on? I was like in the twilight zone. I'm like, this is weird. And then so I'm getting oriented to the software for the charting stuff, right? And mind you, I recognize this is a group of all women. Like, it's bound to happen that there's going to be some sort of animosity. I'm new meat, new blood. Like, if you talk in the movie Mean Girls, right? I'm the new blood. So, And so I just tried to brush it off. I sloughed it off. I was like, forget about it, don't worry about it. And so, but that was odd. Like, she was just very, like, making a big deal out of, like, the air. She's like, this air is so clean. And they all simultaneously put on, like, a mask. I was like, that's weird. And then I started to feel weird in the room. Like, I started to, like, I had to cover my mouth because I was like, I feel like I'm going to faint. Something just made me feel comfortable. And so I was like, okay. My brain was like, I feel uncomfortable right now. This is awkward. I need to get out of this space. And luckily, whatever it was, I didn't faint or anything, thank God. But I did not feel good. I felt like I was going to. And I go, I don't know what that was about. But that was my experience at another hospital. Go figure. So I, of course, that day, and I left my jacket there. I had an Abercrombie & Fitch navy blue jacket, and I loved that jacket. It was like a raincoat / windbreaker. It is what it is. And I don't have anything bad to say about, Virginia. Like, DC was a lot of fun to walk around. Like, Navy Yard was beautiful. Clarendon was beautiful. Like, Arlington. I didn't go to Arlington, but, like, it was just frustrating. Anyways, moving forward. What else happened after? So that was a weird incident. I ended up resigning after, like, a week because I said I can't do it. I was like, I'm not going to work with these individuals. Hopefully, and that was a week, mind you. I didn't put it on my LinkedIn. I didn't put it on my resume. And so then now I was in an apartment in Virginia, in Falls Church, in Mosaic. And I thought about getting a serving job. I tried to, but then the manager, it was a restaurant, beautiful restaurant, almost like Hillstone. And I was like, maybe I can, and I worked briefly at a Roost Chris Steakhouse in Philadelphia when I left the hospital, because I was like, that was back in Philly. So I constantly, even though I get knocked down, I get right back up again. Because that's just my nature. I'm really resilient. Like, I don't take no for an answer, So, I'm sorry, I'm getting, like, a really bad headache right now. Like, my head just feels like, so anyways, wait, I'm gonna turn this off on, or maybe lower this one. Okay. What else? ¿Qué más? So then I was basically trying to figure out what to do in terms of, like, jobs, right? And I knew in Mosaic there were so many restaurants that were in the vicinity of where I was, like Ted Bulletin's, there was Chipotle, there was Chase Bank, there was Pupatella, I think True Food Kitchen was also there. There was a taco place that was really cute. There was a movie theater, and I was trying to date at the time. It's so weird to talk about this stuff because it was about, like, 3 years ago. This was 2023. And then, because I was like, well, what do I do? What if I'm not hireable anymore? Like, I stopped, and I decided, let me try to get certified to teach English abroad. And I was like, maybe I can go to Costa Rica. Maybe I can go to Spain. And I got through, like, I got hired at a swim school, Goldfish Swim School. That was fun, but the kids were really young. Like, the people who worked with me that I did, like, one day where I got, like, oriented. The boss was really nice. The guy who hired me was really nice. But he's like, I should forewarn you, you're a lot older than the teachers, and they're all teenagers. And I was like, it's okay. I was like, I'm totally ready. I can be a role model to these people. I am ready. I want to be a good exemplary candidate and a role model for these other, lifeguard kids, the teachers. And they were just too wild. They were, I was like, there's no way that I can, work with these kids, So I'm going to put this, my feet are cold. So I didn't do that job, and it was like very minimal pay. It was like, I don't even know how much an hour, $14 an hour, maybe $10 an hour. But I was desperate. I needed work, you know. I was going through my savings at the time. I started to dip into my savings. I tried to get into my Charles Schwab stock account for Apple stock because I had a lot of money saved. And then I happened upon Indeed. And then there was a job in Vermont for a nature-based preschool. And this was after I was like, I don't know what possessed me to even, like, I know why, because I've always wanted to, this sounds so silly, but like ever since I was little, when I was in like middle school and I would go to the computer lab, like, they had like the screensaver of like this beautiful like windmill, not a windmill, like a mill, like a wooden mill and a bridge, and they had all the fall foliage, and I was like, I want to go there one day. I was like, I am going to go to that little screensaver wallpaper mill thing. I don't know where it is. I was like, but I want to go there. And then I was like, you know what? I was like, Vermont. I was like, this could work. You know, I was like, let's do this. And I think I applied. There was one child life job for University of Vermont, but I couldn't really find housing near there. They were in the process of making like a building, like an apartment building, but because of all the weird targeting, gang stalking BS, I was like, I don't know how privy I was to living in a building, because I was just living in Mosaic in a building, and I did not like that experience at all. If you're targeted in gang stalking, you will know what I mean, because the people come into your building, or your room or apartment, and they touch stuff, and it's a whole thing. It's horrible. Anyways, because that's part of it, and they'll rearrange things, put chemicals on shit and food, and never leave food open, by the way. If you have open food, please keep it closed, because they'll put stuff in your liquids and shit to like sedate you and get you sick. Go figure. Who knows why. So any Hoosers, what happened after that? So I thought, so I sold all my furniture. I sold all of my furniture, and I said, I was like, I'm going to go live abroad. So I called this TEFL company, and they're like, oh, we can help you get going with that. And do you know where you want to go to? She's like, China and Thailand and Vietnam, they're Asia, you'll get great pay. And I'm like, I don't want to go to Asia. I was like, I'm like, how am I going to get there, first of all? I'm not going to fly in a plane, So that kind of fell to the wayside, and other stuff. The course itself, I was like, I didn't feel like I got much out of it. So I stopped the course. I tried to get hired I did get hired at a upscale kind of casual American, oh my God, this food, I'll say the name, it's called Sweetwater Tavern. The best burger I have had in a long time. Barbecue bacon cheeseburger with these little bread bun things with like honey butter. Oh my God, bro. Oh my God. And the lady was so nice. But even there, so I left, I decided I was going to be a hostess at this job. And then I decided to not do the hostess thing, because again, I would join the group chat for these women, and it was all like 18-year-old, 20-year-old women. And like one girl was nice. One girl, she was decent. She was like the more like focused, and she was the team lead of the hostesses, and I liked her. She was decent. But the other girls, I was like, I can't do this. I was like, I can't work with these young, they were like kids, So I was like, I gave her my uniform, because I bought the exact uniform from Macy's, like the pants, the bootcut Levi jeans, and they had a certain shirt you had to wear. So I didn't do that, because I'm not big on bullying. Like, I can't take, it's just, you want to enjoy where you work. And I already know right off the bat if I'm going to run into problems with people. I can tell. Like, literally, I can tell if I'm going to run into problems with people. So I was like, no, I'm not going to, do the restaurant thing. Because I thought a host, you make it's an hourly position, you're guaranteed income, versus server, you're working for tips. So I couldn't, I was like, forget about that. And then the other job at the upscale restaurant that I wanted to work at, which was very ta-ta and very fancy, and very bougie, the manager who interviewed me ended up going to he left and he went to another location somewhere else. And he was such a nice guy. He was so nice. And so I said, you know what? Nope. So I was kind of out of luck there. And so then I found a nature-based preschool that was based in Vermont. And that was probably the biggest risk I've ever taken in my life, is going to a state that I knew nothing about, but I wanted to experience because I don't know. I think it was just the fact that it was the furthest away from Florida that I could get. And it was like just a different way of living. I mean, I'm Latina and I'm like a city girl. And, this is like, I remember when I first drove into Vermont, it was like, so I had to pass through like all these other states. I passed, went through New York, like upstate New York. I think Massachusetts, right? Massachusetts was, where else did I pass through? I forget. Which was fun. For me, I am someone that enjoys getting in the car and going on a road trip. And mind you, the rental cars, I was still being gang stalked, right, with the targeting. Every rental car I had weird vapors coming through the air vents where I felt like I was going to suffocate. I kid you not. I don't know if it was like refrigerant. I don't know if they replaced the air stuff, the whatever, like the cooling stuff that they put to cool the air. I think they like switched it out and put like refrigerant, like I don't know what they did, but it was very uncomfortable. I almost felt like I was gonna suffocate. I had to wear a mask in the car. I kept the windows rolled down. Bonnie had she was in the back seat. I had a guy from TaskRabbit pack the SUV because I rented a big giant like GMC like Tahoe or whatever. I don't know, it was a Yukon or something. And I left, and life, it's so crazy that it's so crazy the things that I've gone through the past 6 years of my life. But anyways, I drove this big white, I think it was, I don't know, white or black, but huge SUV. And I'm like a petite thing, but I loved it. I love big SUVs. I love pickup trucks. I don't know why, but I do. I don't know why. Maybe because I feel strong and like confident at the wheel, like no one could bother me. So that kind of thing. So I drove to Vermont from Virginia by myself. And I think, I did pass through Pennsylvania. Oh, yes. Oh my God. I passed through Pennsylvania, and I passed through New York. I stopped off at New York, and I actually got I went to Magnolia's because I love cupcakes. Like, I'm a really big cupcake person. So I went to Magnolia Cupcakes. It was packed. And I remember stopping off by the little park and oh my God, it was so fun. That was so awesome. And then I stopped off in Philly at Sabrina's Cafe, but I think someone poisoned my coffee. That wasn't fun. I kid you not, I think someone poisoned my coffee. Because I felt like I was going to faint. It was very scary. I don't know how I revived myself, but I did. And I got my pancakes from Sabrina's Cafe. If you've never been to Sabrina's Cafe, I highly encourage you to do so. It is a lovely restaurant. I did a Yelp review for it. They have excellent hot chocolate with amazing whipped cream. And I wish I could go back again to go to Sabrina's Cafe, but I did order breakfast there. And then, what else? So I drove up, eventually got to Vermont, got to the preschool, or I worked there. I got the first day was lovely. The girl who, she actually drove me. She's like, do you want me to pick you up and drive you? And I was like, oh my God. I was like, these people are so nice. I was like, this is a dream come true. Even, it was a mother-daughter duo, and they helped me even secure, a home. They helped me find the home through Furnish Finder. I have the video on my channel if you want to see. That was a lot of I felt so happy about that little, I had one half of a house, but it was so perfect for me because I was that was on my bucket list to always have my own little house. Even though it was half of a house, but it was good enough for me, I don't need much to be happy. Like, you give me a kitchen, you give me a cutting board, a cozy little couch with a TV, you know, I'm set. Like, that's good enough for me. And maybe it would be nice to have a car one day, you know, like a Jeep. I would love to have, oh my God, a Jeep Wrangler, or I don't know. I always said, what if I could have any car, what would it be? Would it be a Fiat again, like the cute little Fiats, or would it be like a Jeep? I don't know. Anyways, but I didn't have a car. So, but I got there, whatever, I unpacked everything. I returned the car, I think, back to BVI, which is it BVI? The Burlington Airport. And then I took a lift back to St. Albans, and then that's the city that I lived in. And I was really excited and hopeful for this school that I was, because I was like, I had so much respect for this mother-daughter team, just because they were making so many strides in, like, you know, in education. And I was like, okay, I'm gonna get my fresh start. I'm in this small town, even though I don't know diddly squat about it, but I just felt, I was like, okay, I'm going to make the best of the situation. And again, the first day, it wasn't bad. They were very welcoming. They oriented me. I mean, the orientation was a little bit different than what I'm used to, because having come from a hospital setting, like a really prestigious areas, I was kind of akin to this idea that I was going to have like block scheduling, like, okay, you're going to be here at this time and you're going to shadow this teacher, and then you're going to be over here, and then you're going to do self-study. So I didn't really have that. I kind of just went where I was needed, or I felt intuitively I would, you know, so the kids were fun. I mean, I loved the kids. The kids were like, they were so cute. And they all had these really unique names. Like, one kid's name was Arizona, Milo, I'm trying to remember who else. So I just want to check on Bonnie quick. Okay. Hi, you doing okay? See, when I eat certain foods, like right now I had pizza earlier, and I feel like my heart's being squeezed. I try not to think about it. And I'm like, how could someone tamper with a pizza that's already sealed? You know, but go figure. I don't know anymore. You know, I question everything. I just push through it. You push through the pain. You tell the thought, I know you're there. This is my dad tells me, you know you're there. You have no power over me. I wrap you in light and love, and I convert you to positive energy. Hopefully that does the trick, but, you know. So anyhow, what was I saying? So I eventually, they had different locations, and they told me, okay, you can do this, you know, whatever location. I was about like 20 minutes walking distance to this facility, this early childhood education center. And I was really I was so overjoyed, because I was like, oh my gosh, it's outdoor based, so I don't have to worry about being indoors and weird stuff happening indoors with gases or whatever, because that's, my mind was already like scary stuff because of the hospital thing in Virginia. I was like, okay, I'll be fine. It's outside. It's going to be good. And even when it snows and rains, like, they would go outside, apparently. But they would do prayers over their food. They had like a Thanksgiving blessing prayer for every meal. They were very big on like exploratory play. I felt really lucky, and I was like, okay, I'm going to get a fresh start in Vermont. I'm going to be a childhood educator. And just, so like the second day, I don't know if it was the second or third day, there was an incident that happened with a kid where, I'm just trying to remember exactly what happened. First of all, there was something weird that happened with one of the rooms I was in, the infant room. All the babies were crying at once, and they closed. I'm not going to get into that. Actually, I'm not going to get into that, because I don't want to, I still think very highly of those people, and I don't want to bring any, you know, God forbid people know, you know, I just don't. So I will say that one thing that is a tangible, concrete example of like trying to get someone almost to like force them to quit or whatever. There was a mom or a grandmother that accused me or accused the teachers of not giving the son food in the thermos. And my person training me said, why didn't you feed the kid? Like, why didn't you notice that he doesn't have his hot food and we could have done something? And I go, well, the other teacher was there with me. Well, we didn't notice it. And, you know, how was I supposed to, you know that? Like, I was still learning, and I was shadowing, actually. I was observing. I wasn't ready to be fully on my own yet. And then by day 3, they gave me the clipboard and said, okay, we want you to run the show. Meaning, like, run this, because I was a floater teacher, like an assistant helper teacher, but then I was also an administrator. I was like dual role, like I was being cross-trained for an administrative role in like the leadership aspect, and I was doing teaching like a floater teacher role. So and so that third day came around, and I was like, they're like, we want you to run the after school, like the pickup part, or, you know, here's the walkie-talkie, whatever, here's a clipboard. And I was just like, I don't know, you know, like, this is the third day, like, you can't just, and I didn't even shadow that much of it. Like, I didn't know the process of the school, and I said, I'm sorry, but I don't feel ready for this at all. Like, I need more time. And then that's when, you know, because of the incident with the grandmother who said that the child didn't get fed. And then the other thing, they're like, you know what, I don't know if this is the right fit. And I said, I told them before, I was like, yeah, I don't think this is the right fit for me either. So, and plus I was walking there, and it was like a 20, almost 25-minute walk from where I was. And I could have gotten a scooter, I could have gotten an e-bike, but I didn't really want to spend money that I didn't need. So I ended up resigning again for that position. And that was frustrating because I moved there for that job. It took a year. It took me a year to find, it was 2024, December 2024, I worked for, briefly, another company. So I'm telling you, I get hired. That's why I'm like, with the whole watch list thing, I don't understand what this is about, because all the targeting people are like, you're on a watch list, and you're this, and you're a terrorist. And I'm like, I don't think so, because I do the background checks, and when my background checks come back, they come back clear, and I get my fingerprints done, because when you work with children, you have to get your fingerprints done for every state that you resided in previously. So I had to get Florida fingerprints, Pennsylvania fingerprints, and Virginia fingerprints. So, and I get the A-OK and the clear. So I'm like, okay, that's a little funky. So I don't really understand how someone could say, oh, you're on a terrorist list. I will say, I want to interject something. I will say, though, that, and I'm going to get to the second part of what I kind of wrote down, things that, like, I think are relevant or pertinent if you are someone that's targeted, and things that have helped me, or lessons I have learned, you know, after. I don't know if I'm going to break this up into 2 parts, possibly. But my experience of, like, targeting in the workforce or in the workplace and how to navigate that. So, yeah, so it took about, 2024? Because it was June 2024, then December I got hired. Oh my God, I will say this. I got hired at a job, I'm not going to say the company. Really amazing salary. I was going to be an exposure coach for kids with OCD and anxiety. So if you don't know what that is, it was essentially to be the person to help co-treat or co-collaborate with the multidisciplinary team. It was a mental health sector role. And I was supposed to collaborate with a psychologist, a psychiatrist, a therapist to kind of follow along a treatment plan and be the motivator for these kids who were experiencing OCD, stress, and anxiety. And the idea was you were going to expose them to whatever it is that ailed them or bothered them, whatever their trigger was, you know. So it was a 10-day intensive. It was backed by Harvard. Yes, Harvard. And I was going to say I fucked it up. I mean, I don't know if it was just, I'm sure at the time in the apartment there were probably weird things going on. I was experiencing air leaks and stuff. My food wasn't being tampered with at that time. Some foods here and there, like I would order Domino's pizza and I felt a little funky once or twice, but for the most part, my food in Vermont was like pretty stable. I didn't have to worry about being drugged or poisoned or whatever. I did have a few air leaks. I did have like wasps in the side paneling of the house, like a bunch of bees, yellow jacket bees. It was horrible. I got stung like 13 times. I kid you not. There were bees in the toilet. There were bees in my dog's water bowl. I don't know how they migrated inside the house, but I still liked the house. I still liked it. I don't care. It was my little house on the prairie. I was happy as a little clam. I cannot complain. Again, it doesn't take much to make me happy. And plus I got to walk my dog like outside in the rural area, and it was just so beautiful to like see the sunset. And like some people drove really fast in the streets, but it was such a nice change coming from the city life to being more like secluded and less traffic, less sirens all the time. In Virginia, there were sirens all the time, like, and I'm just like, oh my God, I can't. I'm like, it was too much. So I got to experience a taste of like country living, and I did appreciate it. Except if you don't have a car, it's really hard to live country life. Anyways, so what month was that? I forgot what month that was. I think it was June 2024. But then, yeah, I got hired at a job as an exposure coach. I lasted, unfortunately, maybe like 3 or 4 days. And I promise you, I'm not like, because if you look at the DSM, the criteria that meets for like schizophrenia, I'm not schizophrenic, and no mental health therapist and no psychiatrist has ever said that with behavioral this and that and whatever. I know it says like sustaining a job is difficult, but this is because I literally was bullied at said jobs, or I found some incongruency that I didn't feel aligned with me and my professional goals after having been in those roles. It wasn't like, oh, I hear voices and there's the demons coming. No, like I didn't. It was literally is a logistic operational discrepancy is what essentially caused me to want or a toxic work culture. A lot of people leave their jobs because of toxic work cultures, because of micromanaging, or because favoritism or office politics or workplace gossip or mistreatment, cliques, things like that, because that really does lower employee morale, right? Because you're at your job more than you are with your family. So you want to love what you do, right? And so if you're not happy at your job, that's going to show in your productivity 100%, 100,000%. So, but I unfortunately, I did have like a PTSD scare. I got really overwhelmed. I started to cry. I don't know if I had like a panic attack. Like that was for real. Like I'm pretty sure I had a panic attack. I was given the manual that I was given for that job was a 10-day intensive of learning everything from like everything related to OCD, anxiety. Like I learned the protocols. It was such a good job, and the salary was like $67,000 or $64,000 to this day. And the reason why I left that one, I had a weird episode with the PTSD thing, and then I'm sorry, there's the truck going by, so if it's a little loud, I apologize. So yeah, I left that, but then I just, it was too overwhelming. And then there was this girl who literally, if you look at my picture for LinkedIn, I'm not gonna say my last name, but my picture for LinkedIn, I got this sweater from Target that I was really proud of because it reminded me of a sunflower. And I tell myself, I'm like, I pride myself on being someone, I try to be like sunshine in people's lives. I try to leave them better off than when I first met them. And so this shirt, I'm very big into color theory. So it's a very bright yellow sweater. And I got it when I was in Virginia at the Target over there. And this girl in that same company, she reached out to me, and her picture, literally the same pose, the way her hair was, the way she stood, and her shirt was literally my shirt. Like she literally replicated me. And I was like, this is such, and I go, what is this about? Like, why is this woman trying to copy or emulate me? And that to me was a mind game thing. And I was like, and I didn't have thick skin back then, and I let that affect me. And I regret that so much because that was an excellent job. And I was just on my way to getting patients, like, to work with. Like, I was on my way to being assigned to being completed the training, and I regret that so much. I really do. If I can go back in time and just been like, who gives a shit? You know, it's just a girl with a yellow shirt. Who gives a shit, you know? I lost out on an opportunity also because of the you know, complex PTSD thing, because I broke down. I was worn down. I was tired. I was exhausted. I was still seeing weird content show up on my YouTube feed, and my phone was being weird, my computer, everything. So I ended up resigning from that job. Then I got another job from, because I was very diligent, and I found a job in sales, for educational sales, for K through 12. I'm not gonna say the company, but like, it was a remote job, because I told myself, you know what, I can't do the in-person job anymore. I don't think that's gonna work. And I was too rural too. Like, I was too, like, to go to Burlington, which is like the metropolitan area of Vermont, you had to get on a bus, and it would take an hour and a half or 2 hours. It was a 30-minute car ride, but it was cheaper because it was a $2 bus ride. So, but still, I couldn't, I decided not to do anything in Burlington or do serving or stuff like that. So I contemplated doing Uber Eats and DoorDash. I was like, I can buy a scooter and do like Instacart, or like, you know, I did. Like, I talked to a credit counselor person because my credit started to plummet. Because at this time I was going through, I wasn't employed. I had to use my savings. I had to use my credit cards to survive, because I had a credit line. I had like over $100,000 of credit line at the time. But I started to I used my Instacart to buy groceries. I did get on Snap eventually, because I didn't know what Snap was. I was like, oh my God, they pay money to help people pay for groceries. I was like, yay! But I only got like $200 out of it. And you have to be working. You have to keep a steady job, right? So I did get that. I got on Medicaid as well. I don't mind disclosing this. Hey, thank God, bro. Thank God for fucking Medicaid. Thank God for Snap. And if they take away Snap, I will be so sad, because I'm not on Snap now, but like, there's a lot of people who rely on, you know, welfare, that are not like mooching off the government, and they're not committing fraud. They just need that supplemental nutrition assistance, especially if they have kids, because sometimes circumstances dictate that certain people fall under certain socioeconomic statuses just because of, you know, generationally. In Vermont especially, that families generationally end up in poverty just because the cycle continues, and it takes one person to kind of break that cycle. But I think Vermont is like that #1 state for social welfare assistance, which I didn't know until after. So I felt very fortunate that I am blessed that I was able to get that support. But I did get hired in educational sales as an initial sales consultant for a company. Excellent training. But then it came time to when I was almost done with the training, where they did this thing called Game of Phones, and they had us compete with our cohort. Here, you want me to open the window for you, baby? 2 seconds. Bonnie wants me to open the window. Okay. So basically, they had us compete with our cohorts and our colleagues in the training class to tally how many times we did transfers to the senior sales consultants. And I am not one at all. I do not like competition. I don't want to compete against my people. Like, I don't want to. Like, I want to focus on the job. I want to make customers happy. I want to create memorable, positive experiences. That's what my focus is. I don't care about what Sally Sue or Bobby McGee makes, you know. I just don't care. I don't need that extra added pressure, whether it's from society or a certain training class, to motivate me to succeed. I don't need that. I don't need to be incentivized by competition. I put enough pressure on myself to succeed. I don't need it from people that are strangers that I don't know. I will say that the training was fantastic. They were super thorough. Hi, Bibber. Your head feels warm, Bibber. Her head feels. That's what I get nervous about, poisonings and druggings and stuff, because that's my first indication. When you get a fever, or your body temperature rises, because that's your body trying to fight off something, right? That's your body's alarm system. So a headache and all that definitely indicates some sort of misalignment in the body. Hi, are you okay? You going to say I do the doodles? Did they watch the videos? What? She's like, okay. So anyways, it's so weird talking about it and like reliving it, but you know, I guess maybe it'll help somebody. Hi, what are you doing? You want to be in the thingies? Are you standing on you're standing on the chair? My dog likes to lick my armpits. I don't know why. Are you okay? Don't lick my mouth after you lick my armpit. It'd be a little weird. Anyways, what was I saying? Initial sales consultant, they would do a thing called Game of Phones, and I guess they were just trying to make it fun, you know, for people. I just don't like to compete against people. It's just not my nature. I just want to do a good job. Like, give me a rubric, give me metrics, and I will just try to excel and exceed, you know, in that capacity. Whether it's child life therapy, whether it's sales, whatever. So I ended up resigning from that one. I only did it was December 9th, right? Or no, to December 19th. I did 10, I don't even know. But the people I have nothing bad, the trainers were wonderful. I mean, I can't say anything bad about them. They were so good at what they did. And yeah. And I do wish I had thicker skin, because I would have just bypassed and I would have been like, whatever, just play along with the thing and move forward. And now I'm sitting here it's so hard to find a job. I feel I know they say that there's more applicants than jobs. I feel like there's more jobs than applicants. I feel like it's the opposite. I feel like there's less jobs, more applicants. You know, and there's new graduates who just graduated from college, you know, back in May. So it's how are they going to get into the workforce, you know, without any work experience? So go figure. And I'm 34 and I have 14 years of hospitality experience, and I have and if you say, oh, then you're in Chicago, there's so many opportunities for restaurants and things. Well, when you're targeted and stuff, it's not that easy, because I have to watch my phone. Uh-oh, I think she's gonna do potty. We're gonna walk and talk. Walk and talk. Oh, what did you do? Oh, she did pee-pee, okay. Goodness gracious. So yeah, you know, I have 14 years of experience overall, in the workforce, and then, you know, I have 5 years, basically 5 years. I say 5 years of healthcare experience, because that's essentially what it is. I guess I'd be construed as a CCLS 2 by now, maybe. If we're going by years, I would be CCLS, but I know I'm a CCLS 1. Oh, she's gonna do zoomies. Here we go. Bonnie zoomies. I'm sorry that my bed is unmade. I moved from a 1-bedroom to a studio, but you know, I feel very fortunate. If you've been following along my story, but anyhow, are you good now, Bibber? So, what else? My headache went away, thank God. So initial sales consultant, and I bowed out from that, and I was like, I don't want it. I was like, this is not going to be a good fit for me. Other things too, I think certain references within the job, I think within the chat, I was like, I don't know if I want to work amongst these people. Again, I wish I developed thicker skin and I would have stayed put in that job, because now it's I don't know. I just, looking back, I go, and I'll get to the next key points of what I'm going to say, you know, about tips. I hate the word tips and tricks. Trigger words, right? But Are you good? Are you good? What, Bibber? You're so silly, Bibber. So, yeah, and then after that, I'm trying to remember what happened. I think, was it 2025? Yeah, it was 2025. I'm not going to get into what happened in 2025. I tried my hand at, I guess you could say, entrepreneurship and content creation. I'm not going to get into what exactly that was, but because people have their reservations and their, own preconceived notions about that, and I didn't really know what I was getting into. And it was, I don't mean content creation like making funny videos or, I mean, I made videos. I started doing YouTube. I created a YouTube channel, this thing, but I also did like other stuff that I don't know. I don't know. I'm not going to get into that, but I did that back, I think it was like in May, June, July. I was just, because I wasn't getting anything. I wasn't getting anywhere with remote work. Like, I tried so hard to find remote work because nothing was working out for me, no pun intended. I considered trying University of Vermont with the child life thing, but it would have been too hard to get on the bus, and and then I thought, oh, let me get a car. At one point, I swear to God, I didn't know how car buying works or car leasing works, and thank God there was a guy who was the taxi driver who took me to and from places for doctor's appointments and groceries and stuff, and for Bonnie. And he's the one who explained, do you understand how car buying works? Because I called the debt consolidation guy, because what happened was I started to put all my groceries and my rent on credit cards because I had credit line. And so I didn't know how credit cards, I mean, I kind of knew how they were. I just knew that you had credit line or whatever, and I thought that was like your money or whatever, and it's not. It's the bank's money, and you charge the card, and then so I was relying on credit cards to, for groceries and whatnot and rent. So, but he said, one guy from Clear One Advantage, he's like a debt counselor or whatever, and he's like, oh, my wife and I did deliveries for DoorDash and Uber. He's like, you should look into that. And I'm like, but I don't have a car. And he's like, oh, that's true. He's like, well, maybe you can get one through Lyft, and they have like a rental program where you can rent the car. And I was like, okay. They didn't have it in that area. They didn't offer it in Vermont. I was too remote. And so I was like, let me try to get, I think I tried to like look into getting a car, and I just, thank God I didn't even know like the process. Like, you have to, like, the bank lends you money or something. I still don't understand how it works. I'm taking a financial literacy course to try to understand credit cards and all that better. Because it's important to know this stuff. Like, I don't know. Anyways, here, I'm trying to understand it better. That's all I'm gonna say. I wasn't stealing, I wasn't doing it. I literally was like, oh, I have credit line, I'm going to use my whatever, and I'll just pay back. And I learned about minimums. I didn't know what a minimum was until the Clear One Advantage guy said, oh, you don't have to pay your things in full, you can do a minimum. And I'm like, what does that mean? I'm like, that's what that means on the bill? Because I never understood it. If you have children and you're watching this video, please teach them about that stuff, financial whatever, because I didn't know about that. Even though my parents, I will say, they did try to kind of teach me a little bit, but like the nitty gritty of it, I didn't understand. Anyways, I'm trying to remember what happened after. Oh, okay, so content creation. I started to do flip videos. If you don't know the Flip app, it's kind of like TikTok, but it's more like real world issues with people. You want to sit on the thing? Go. You can sit up there. Come on. It's like real world things, and you record yourself, like TikTok videos. People do reviews of products, and I made about like $50, like just in like a month. I made like $50 just doing this, and I said, you know what? I want to try UGC. So I learned what UGC was, and then I was like, they give you products, you have to buy them, but then you promote the products on your page, and it's kind of like, yeah, you pay money, but like you get products at a discount, and then that's the caveat, I guess. You get discounted products, and then you promote them, and then if you garner enough followers, you can do affiliate marketing, which is you use a link, and then they use your coupon code, and then you get commission off of that, allegedly. I have yet to make a commission from, and I stopped it. I stopped doing that because I just wasn't successful in it. But I was doing content creation in some other way, which I'm not gonna get into, just because people have their reservations about that, and they develop a preconceived notion about somebody, and then being targeted already, people already will create other narratives about me that aren't even true at all. Recently, a target individual told me that they accused him, or they tried to frame him for being a PEDO, PHILE. And I've even wondered this about me, because I would see a lot of trucks go by me that said the word cougar. He said specifically that people would put younger girls in his path on purpose. And it's funny, because when I was at rest stops driving to and from places, there was a group of young boys that were like walking, like purposely planted themselves in front of me. It was weird. It was so weird. And I go, do people do that, like with targeting? And it would explain a lot of the stuff of the reason why I'm going through what I'm going through, because maybe someone started a rumor, or maybe that's why it's been hard to try to get jobs. And so I don't even want to know. If someone lied about me and said that I was a PEDO or something like that, bro, I don't even know what I would do. I would be livid. I would need a lawyer, first of all, because that's just like slander and defamation, and 100% not true. And that could literally ruin the whole trajectory of someone's career. Unfounded, unsubstantiated claims about someone's character and well-being, that is wrong. That's defamation of character. And if I ever found that out, bro, I'd be livid, because it's so far from the truth. Anyways, so what happened after that? So content creation time, that was summertime last year, right? 2025. Made some money. Realized that it wasn't, I'm not going to get in the nitty gritty of what I was doing, because I know people are going to be like, oh, she's a WHOR. Like I was basically, I think, almost groomed to doing that stuff, because I was down and out on my luck and I wasn't getting hired anywhere. So don't like that. Don't like the chair, please. Don't do that. I'm not mad at you. I'm just saying don't like the chair. So, trying to think. Timeline of events. Content creation. Moved from Vermont to Indiana. I don't know why I chose Indiana. If you wonder, oh, why did you choose Indiana of all places? Like, why did you? I was scouring Airbnb to try, because I couldn't qualify for a lease. I don't mind saying this. This is my story. Maybe it'll help somebody. I couldn't qualify for a lease. You have to make 3 times your rent to do that. I didn't have enough in the bank. Like, I already was going through my stock that I sold for Apple. I went through my savings of like $100,000 something from starting as a server at 17 years old. And then, yeah, I'm trying to remember. Did I have any other savings? I think that was it. And so, okay, so it was September, right? 2025. That I moved from Vermont. I packed, literally, I remember top to bottom, cleaned, spick and span that apartment in the duplex in Vermont. And I just, at 4 or 5 in the morning, I drove through, I went through Plattsburgh, I went through, and I think Hancock, New York, like, I just by myself. I remember it was very foggy. I was scared. Like, I chose Indiana because, I don't know, I guess I wanted to go more west. I was kind of over, like, I couldn't find anything in the East Coast. I tried Florida. Oh, it's cold. Oh my God, it's cold. I tried Florida. Fort Myers, Cape Coral, I tried all of these different places, just because I was like, Florida's familiar. I thought of Orlando, just because I missed home and I was kind of craving the beach. I thought of New Jersey. I thought of Philly, going back to Philly again. It's really, really cold. I need to turn this off. And Airbnbs, there's only so many options that you have, with that. And you're living in, I didn't really know, because that's the thing, I had to use my credit card again because I didn't have the funds. You have to be able to, and there's people who are nurses and do short-term, leasings and stuff. I didn't realize that when they do Airbnbs. It's actually more common than I realized for people to do 3 to 6 month, stays, especially travel nurses or like digital nomads. So, hi Bear Bear. Oh my goodness, look at this little face that they're peeking out of the thing. This is what she does. So when I was working remote, she would often sit and then her little face would appear. Thank you. Are you giving me kisses? Thank you. So yeah, I chose Indiana because I thought, let me go more west. Let me see what that's about. And I was like, maybe I'll try Chicago. Or Illinois. I didn't think, I don't know. It just, the past few weeks of the Indiana time, I had the most arduous and frightening experience of my life in Indiana. I will never forget that as long as I live, and I try to make the best of it. The first month I was there, I had a really small kitchen. If you see the videos, I don't know if I posted any videos of that kitchen when I was there, but it was a very small kitchen. I lived in a town called Greenfield, and I loved the park. There was a park, Riley Park, about 10 minutes walk away, and I was my favorite part. I loved to see the ducks in the pond. I went out on one date there where the guy and I played frisbee golf or something like that, disc golf. And I also had one date where he invited me for Thanksgiving dinner over to his apartment, so that was decent. And he didn't hurt me, thank God. I swear to God. I was so scared that I was gonna get hurt or something. I'm very brave when it comes to I never realized how brave I was when it comes to dating and stuff, as a targeted person. But I did enjoy the first month there, and then I continued to look for work. I got hired at a athletic sports recruiting company based out of Florida. And I don't, how do I say this? It was between that and then another job that was like a digital marketing agency. But I went with the recruiting athletic one because, I wanted to, it was aligned with kids, and youth and sports. And one of my bucket list goals was that literally I wrote, I want to understand sports better, and football and soccer. And literally I was so elated to learn about all the different sports. That was my favorite part of the job, was when we were doing training, we would learn about baseball. And then I learned about, all the different things for baseball. And then I learned about, what else? Soccer's still confusing to me. I don't know why. There's so many people on the field. I still don't, I don't know. So I was hopeful, when I started that job. There were kind of instances, though, that I felt like I was kind of being bullied indirectly and passive aggressively, but I tried to brush it off. I thought it was like, oh, this is mind control or whatever. And I was like, Ashley, just let it be. Some things are not worth, crying over or whatever. Just, let it be. In the words of, Paul McCartney and John Lennon, let it be. And I should have just, been grateful. I was grateful. I was like, I remember I was watching football games, I got really into like watching different sports, and I wanted to watch volleyball. I mean, I was watching volleyball games on YouTube, and there's this whole world that I didn't know about, that like with youth sports recruiting and college recruiting, and you know, unfortunately I didn't have ESPN. I still want ESPN, but you know, I don't know. And so unfortunately, so I lasted 2 months there, because there was a guy who looked just like the guy that this all started with, and that kind of set me off and triggered me, unfortunately. I got, you know, upset about it, and looking back, again, you know, I look back and I go, I should never, which we'll go into part 2 of the video, which is the key points, that the key takeaways I've learned from my experience with, and I know if you say, well, you should do 1099 jobs, you should be your own boss. I've thought about it, trust me. I've thought about everything. I thought about starting my own business. I was like, I've always wanted to have my own bakery. You know, I can't do that. You need like an industrial oven to do that. And Chicago, you know, even Greenfield, Indiana, that's futile. Like, there's no way. You can do jewelry making, you can do whatever. It's just, but I didn't have time to do, you know, my funds were depleted. At this point, my credit cards were getting closed because I wasn't paying them. You know, I wasn't, like, the minimum amount, like, it was just adding up and piling up over and over and over again. And I was just like, this is horrible, you know, like, and then, you know, eventually they get charged off and they go to collections. And so it was just like, you know, and I kept telling myself, I gotta get a job. And I had one, but it's like every single job that I get bullied at, or, and that's just not fair. You know, you want to love where you work. And then at the same time, my certification as a child life specialist lapsed. So what that means is that, so when you're a child life specialist, you get 5-year certification cycles. Just like, you know, nurses, you have to do your PDUs and to keep up your licensing. So it's the same thing, or like your boards, like when you're a doctor, you have to do, you know, your boards over again. So it's kind of the same idea. And you know, I had it on my radar to do, and I kind of did some. I did a few webinars, and I tried to keep up with it as best as I could, but you know, I didn't meet the threshold, the 60 PDUs that you need to maintain your certification. So by December 2025, I lost out on that. So, you know, and that's my niche, you know, like I realize I'm kind of like a chameleon. You put me anywhere. Like if I had to learn equestrian horseback training or whatever, you know, there was a point where I thought maybe I could do equine therapy. I'm not kidding. I was like, I actually did equine therapy for me as like a client, in Spring Mills, Pennsylvania with, at the horse ranch. And I was like, maybe I could do equine therapy. So, you know, anything I put my mind to, if you plop me anywhere, I will learn the skills. I'm very adaptable. I'm a quick learner. I think that speaks well to me as a person. Like, I'm very versatile. But the thing is that, like, that's, child life therapy was my niche. Even, like, mental health therapy, like, that's my niche, and I want to pursue that. And unfortunately, you know, because of past experiences in hospitals in the past, you know, I don't know what that would be like, you know, anymore. And then also having a dog, you know, having a pet, it makes it that much harder, because now, you know, and then you have to pay money for people to watch her, walk her, whatever. And I don't really trust anyone coming into I already get nervous about maintenance people, or someone coming into, you know, here without my consent or authorization. Imagine having someone have access with a key. Like, I don't know. Or I can get my parents to do it. I don't know. I'm still skeptical, you know. That's why I've been choosing to do remote work, because I go, if I do remote work, then I'm afforded the ability to be with my dog. And, you know, she sits, this is what she does when, you know, she sits under the, hi, Bibber. She sits underneath the table. She loves to sit there, you know, and just, you know, whatever. So, yeah, so it's been very difficult. And then just having to overcome also the weird stuff that I've experienced with what felt like being poisoned or drugged and whatnot. And it's hard to prove that, right? Like, how do you prove that? I shouldn't have to buy test kits and stupid stuff like that. You know, so I'm in the process of trying to get the appeal for my certification, and that just means that, like, I would be able to not have it reinstated, it would be in limbo, but I would be able to do the PDUs to, you know, maintain my certification. It would be a blessing from God, honestly, if they were, you know, but still though, like, what would I do with that? You know, I've thought about maybe trying to start a business with, you know, offering child life therapy or at a consultative basis. I don't know what that would look like, you know, because child life is really not a billable service. You don't, it's not, there's no was it ICD or ICT, whatever the codes are for insurance, there's nothing with that specific to child life therapy. So it would just kind of be like, I think, an out-of-pocket thing. But I don't know, I'm still hopeful that I can find work. I think I am hireable, but it's a matter of, one, feeling safe, because I don't feel safe still. Like, when you're targeted, I don't feel safe. Point blank, period. If you watch my other videos, like one of the videos, because I had stopped doing the YouTube thing, I'd stopped posting, and then when I got to Chicago, weird stuff started happening, you know, in this building, and, you know, living here, and I did kind of like a PSA that was like, I'm scared, I need help, can someone, you know, give me answers to things, because I don't know what's going on, and I feel like I get sick every time I eat something, and I've never had food insensitivities before, no food intolerances. I've been able to drink milk very easily, I've been able to eat bread very easily, and suddenly a bunch of these things, and trust me, I can play devil's advocate and go, oh, psychosomatic symptoms, your mind is thinking things, and you can have a buildup of panic. No, like, I get a huge headache, I sometimes will shake, and I will sweat, and then I've had it to the point where sometimes my eyes have gone double vision and gotten blurry, and I felt like I was roofied or I was drugged. So I'm not, like, lying about this stuff. So, and also I did a heavy metals test, and it said that it came back positive for, like, aluminum, and I'm like, what the fuck? I'm like, what? I'm like, I don't eat aluminum. I'm like, I don't have deodorant. Like, I don't know how that's possible. So something's going on, you know, and I don't know how to get rid of that, but, you know, either way, it's scary, you know, and I'm just trying my best, you know. Sleep feels like a distant visitor, you know. I'll be honest, like, I've had sleep paralysis, I have really bad insomnia, and you could say, oh, go get ZQL. I'm afraid to get medication. I'm afraid to get anything over the counter, because I'm like, what if it's tampered with? You know, I don't know who I pissed off. I don't know, you know, the powers that be and things like that. I don't, you know. So, I'm hoping that, and I know people say, oh, you need to leave the country, you need to go abroad, there's better opportunities. Listen, it's not a one-size-fits-all thing. Like, I honestly think it'll happen anywhere that you go, and people don't understand it if they haven't lived it. Like, there was this one guy on YouTube who's like, oh, all the gangstalking people are all crazy and they're just delusional. I'm like, oh, boo-boo. Sit back in your gamer chair and, you know, say that to my face, and I will school you on shit. You don't want to get in a debate with me, because when I find the facts, I go hardcore. I didn't go to law school. I think I would have made for a great lawyer, but you know, when I put my mind to something and I research shit, like, you don't want me to research stuff, because I will go, like, I will look for the answers, and I'm relentless in the pursuit of excellence. So whenever there's wrongdoing and injustice or anything like that, those are like the things that piss me off the most. People that lack integrity and dishonesty are like the most, like, I cannot. So, yeah. But that's kind of my history of my work history and like the things that I've experienced in, situationally relative to gang stalking and targeting. When I was shadowing, because I also wanted to be an occupational therapist, I got into OT school a few years ago in Florida, and I had to forego that because I moved, right? And so I remember even when I was volunteering at certain clinics and stuff, I had weird stuff happen. Like, weird shows would show up on the TV, or like they'd have the systems would go down, like at the clinics I was working at or like volunteering at and shadowing. Their whole system would shut down. They'd have issues with their computers wherever I went, or like the TVs would go off, their computers would stop functioning, just weird stuff. So that was kind of concerning as well. So, because I was like, oh, the person doing this, they're trying to provoke me, and they're trying to show, oh, I'm watching you, and I know what you're doing, and I know what you're up to, and that was really, really scary. I don't take that lightly, and I reported that, but I don't think people took it seriously. So, you kind of I just let it be, What else? So, what else is there? Now I'm just kind of, I'm in Chicago. I did move units in the building that I'm in. I feel grateful to have a roof over my head. Do I still feel safe? Not exactly. Was it the right move to stay here in Chicago? Well, I don't really have a choice, because I don't want to I could use a credit card and I could stay in an Airbnb, but the only ones that are within my price range were like tents. And I'm not going to live in a tent, in a random vast expanse of land on a camp reserve. I'm just not going to do that. I know that'd be very entertaining for people, but I'm not on Fear Factor. I'm not on the game of Survivor. This is my life. I'm a real human life, and it's not funny to, like, if my story was told back to someone, they'd probably go, wow, this woman has been through hell. Like, this woman's been through a lot. And we all have our own struggles. Like, I can't even sit there. There's people who are going through things like way worse than I am. But one thing I will say is that, like, it was an injustice that was done to me, and I feel like it was humiliating. And part of that, I think people wanted to withhold or restrict certain foods or access to, clean water, just out of spite or greed or envy. And that's so evil, it's so evil. And I've gone back and forth, and I told myself, what is going on? Am I like being sacrificed? Is this a religious thing? Is it political discrimination? I don't consider myself to be a political figure at all. I have very few people following me on social media. I thought maybe it was a smear campaign, like someone lied about me and tried to set me up or say that I was involved in, like, egregious activities or malicious activities or fraudulent stuff. And I literally have, like, racked my brain trying to figure out what it could possibly be. But I will say all my fingerprint stuff comes back clear. It says that I'm not on a watch list. Because I did a background check for something recently, and it says that I'm not on a watch list. So I don't understand what this is about. And I tell myself, maybe it's a test, but why would you test someone for 6 years and put them through all these horrible things and scary circumstances and near-death experiences where I could have literally died, Or is it there's some criminal aspect to it, and there's a group of, like, fraudulent people or hackers or scammers who are malicious, like, bad actors that are just and I don't mean acting like theater, like bad, like just bad people, you know. I've run the gamut of what I thought it could possibly be, but I will say I have experienced some very scary stuff as of recent. Like I was back in the other unit that I was in. I don't know how people are able to do it, but somehow I think I was exposed to some toxic, poisonous gas of some sort, where literally, I kid you not, my tongue is still burning. Like, I don't know what I inhaled, but my tongue is still burning. I didn't eat anything hot as of recent. I lost the ability to breathe through my nose briefly for a few seconds, and I like got jolted up because I was sleeping down, you know, when I was downstairs and in the other unit, and my throat closed up. It was very scary, and I remember calling like my dad, or I don't know what I did, but I freaked out. And so it's scary, and there's things that are beyond my control that I can't fix. You know, that is so petrifying to know that someone could hurt me without touching me, and I would never know about it, because literally I could be in my sleep, and if they expose Bonnie and I to something, that's it, and I croak, and then it would be ruled either, I don't know what it would be ruled out, a freak accident, like an aneurysm, I don't know. I'm not a doctor, but like that's just kind of what I surmise would happen. Because I don't know who I pissed off. I don't know who, I don't know. You know, I don't know if there's secrets, like things that I don't know, and all I know is that I did a report on somebody back a few years ago in Miami, and my entire life changed because of that. It was just like an incident report. It wasn't even like a huge thing, but the police officer said, okay, now it escalated to the FBI, reported to the cybercrime unit at FBI. So I did. I haven't heard back from anybody. Am I hopeful? Yeah. I have some family that say, oh, you'll never hear back from anybody. You'll never get closure. You need to move on. You're not going to get the answers that you seek. And it's really discouraging when I hear that, because if I was a mom and I had a son or I had a daughter who was going through this, I would do everything in my power, even if I didn't have the answers. I wouldn't say that. I would say, I know this is hard, and there's a lot of things that are kind of up in the air and are uncertain right now, but you can guarantee that you have my full support, you know, throughout this whole experience. And I don't doubt you once, I don't discredit you, and I'm here for you, and I love you. That's what I would tell my son or daughter. And I hope that if you are somebody that are going through this, and I know sometimes it seems like it's not probable or possible. I need you to take the limitations off of your mind, because it is 100% possible and probable. Anything is possible. And we're not all, you know, all these people that are targeted aren't just sitting here. People are going online saying, please help me. Like, there's obviously some discrepancy or something wrong. You know, there's obviously some sort of deceit or dishonesty and incongruencies in respect to that, because it's just not normal that you have a bunch of people, and I am perfectly sane. I'm not psychotic. I don't hear voices. I don't have hallucinations or machinations. I'm very in touch with reality. I don't disassociate. Only time it felt funny is that if someone, I think, purposely drugged me with something, or my water or my food or my soda, with delivery orders, or even like shower water. I've had my shower water, I think, messed with. And if you say, oh, how is it possible? Because that's the water for the whole city. Someone could do that with your own well. I hate to tell you, like, you know, it's a lot easier than I think what people think. And it's very scary because there's no touching involved. I haven't been like touched once. Like, no one's physically accosted me. It's all been slow, progressive, just degradation of, you know, psychological warfare and spiritual warfare. And just, I hope, I mean, if I ever found out the truth about, if someone lied about me and tried to frame me or said that I was a PEDOPH, I mean, I don't even know where to begin with that, because that's like, I've seen that in forums where people get wrongfully labeled as that. And like one guy, I remember when I was in Virginia, he said he was like a pastor or something, or a preacher or something, and that he was wrongfully accused of being like solicitation of minors or something. And I'm just like, this is crazy. People just make up shit out of thin air about people to serve their narrative so that that person can get targeted and brutally almost killed, or let alone murdered or assassinated. I mean, that's insane. You know, think about that. Like, that's my well-being, that's my character, that's my safety, that's my livelihood, you know, of like my life, you know. And to create a rumor like that on someone, I don't even know, you know. All I can do is just hope and pray that like one day, I don't know, that someone is brave enough to tell me the truth and helps guide me to safety, because there's only so much that I can do, you know. And I have had it where I've touched packages and mail where like I touched it and I nearly almost like suffocated, or like it took my breath away. I've tried on clothes, you know, things that I've gotten in the like packages, and I literally put the clothes on and I almost like fainted. I've been like, when I was in Indiana, I went downstairs to the basement to the laundry thing, and I felt this weird, I smelled a weird smell, and I was like, what is that? Nearly almost died. I'll never forget that as long as I live. It was so terrifying. It was so terrifying. So, you know, I'm going to do part 2. It's probably going to be a really quick video, part 2, because I don't, I have like 7 things here. I don't know what number 7 was, but it's just basically key points in terms of like how have I survived? I mean, I really haven't survived because I've quit or resigned from jobs, and it looks so embarrassing, especially for, I'm even surprised. I'm bold to have a LinkedIn, because I literally, the stints that I have in some of these jobs are so short, and I'm like, well, what do I do? Like, what are the solutions? Do I do 1099 work? But if you do 1099 work, yes, you're contractually, you know, hired, but the thing is, you don't get medical benefits. You have to pay out of pocket for that. And then also taxes, from what I understand, you're an independent contractor. So like, you have to be responsible for removing, because normal W-2 salary jobs and hourly jobs, they take the taxes out, right? State and federal taxes. That took me, I can't believe I said that. I finally understand a little bit more about financial stuff, because I didn't understand it before. So they take that out. So, yeah, it's just, you know, it's been hard. And, you know, eating has been so, I've never, you know, eating food and stuff and drinking water and beverages is just, that's been challenging in of itself, because, you know, I love to eat, and because of a few traumatic instances, I get so nervous, you know, to eat. And, yeah. I have a bird body sitting on the bed. So, I feel grateful to be alive still. That's a gift in of itself. I know with gangstalking, people expect people to give up and take their life. I mean, that's the goal, from what I understand, either to have you homeless, on the street, unalived, in a coffin or an urn, or like institutionalized and put in a home, or sick. And I just don't understand how people could do that to like other people, like other human beings. I don't, for the life of me. So I'm grateful to still be alive, to have my, you know, be awake, and sometimes I think I stay up late and I don't go to sleep because I get scared that I won't wake up, or that, you know, I don't know, you know, like I want to enjoy all the waking hours that I have, because it's like any moment someone could say, hey, let's expose her to some, you know, cyanogenic gas, or some, you know, VOC or something, or whatever poisonous flower or substance, and then boom, I'm gone, you know. That's all it takes, folks. You don't understand. Like, they're people, I don't know who are the ones doing it, but they have enough ability to do all this stuff, then, you know. And if you say, oh, go to another country, trust me, I don't have the funds to do so. You know, I'd be moving to another country with, you know, nothing in my account, you know, nothing, and, you know, with $60,000 of debt that I have to, you know, That's basically my degree. My OT degree was like $70,000. $75,000 I think it was gonna be. So it's not that easy. And to me, as a family member told me, wherever it goes, it follows. Like, it'll follow me. So if I go to Italy, if I go to France, if I go to South Africa, the same shit would happen. So it's not like, oh, I'm gonna go hop on a bus or a boat and whatever. No, not how it works. So, you know, I'm gonna get to part 2 now. I have to start a new video. And those would be the key points of the things, the key takeaways of what I've learned, you know, and how to best survive, you know, this thing called targeting, or, you know, I don't want to say premeditated murder, but it is like a slow kill, no touch torture kind of situation. I know some people want to be like, oh, but it's for science, and this is, no, I don't think it's science. Science, inflicting pain and horror and hatred and emotional neglect is not scientific. That's just abusive and violent. So, yeah, if you do have any answers, I've said this before, it'd be much appreciated. If you happen to be a lawyer, I don't know how to go about that. I can't pay a lawyer right now, so I don't even try to attempt that. But you know, if I was a victim or possibly of like slander or defamation of character, then I do need someone to, you know, represent me, because it doesn't make sense, all this stuff, like why someone would sit there and go so hard to drug someone or poison them or hurt them and, you know, put them in harm's way, and then try to discredit them and denounce them as crazy or paint them out as fraudulent or whatever, you know. So a lot of people could do a lot of damage. When they hack your stuff, people can do a lot of damage to your reputation and your identity. So please be careful, you know, be careful what you click, be careful what you sign up for. I am the queen of free trial subscriptions. I always end up, you know, forgetting to cancel, and then they charge me, you know, they reinstate the what's it called, the subscription. So just you know, be mindful when you do that, because if you do that, then you click something and they could bro, what is this guy doing? I was like, why is just, yeah, so be careful, because if you're like me, you click on a subscription and you do the free trial thing, and then you'll end up like, you know, with more debt that you, and then you have to contact the people, and then they have to cancel the subscription, and it's a whole thing. So any hoosers, I'm trying to think what else to say. So I will do part 2 in a moment, and yeah, so if you watched this far, then God bless your soul, and that's it. You know, thank you for watching, and God bless America. That's all I could say. Because you know, every day is a new day, and you never know what you're gonna, you know, come across. Some people could be in a good mood and be like, no, we don't want to bother her today, we want to let her have a day of reprieve. And then other days it's like, no, we want to murder her and kill her, you know. So that's because it's too much, and she just, you know, and I'm like, well, what did I do wrong? I didn't do anything wrong. I did nothing wrong. Absolutely nothing. Zero wrong. Completely innocent woman who did nothing wrong, getting wrongfully targeted by God knows who and God knows what. Exciting times, folks. Imagine going out to a restaurant or trying to live a normal life, and you don't know if the waffles that you're eating, or the soup that you get from the supermarket, or your grilled cheese has a lethal dose of, I don't know, what do people use? Arsenic? Cyanide? I don't consider myself that important, but Yeah. Exciting. But then I'll be framed and people will lie and say that I'm a PEDO, PHI, or whatever, and I've never, ever abused a child or a teenager in my life. Ever. But it's interesting how things turn out. You know, you do the right thing, you follow the rules. You know, you go to school, you get the degree, you're the good daughter, and you nearly almost get killed for, I don't know, being a good person, I guess. So I feel grateful to still be here and be alive. I don't know how much longer that will be for, because, you know, the powers that be, you know, one day it's oh, we'll let her live, and the next day it's nope, we gotta kill her. So imagine having to face your own mortality. You know? That's my norm. Your norm is, you know, waking up, maybe taking your kids to school, watching them play on the playground, going to your golf lesson, you know, hanging out at the local marina, you know, I don't know, wherever. And for me, I have to wonder, hey, what vendor can I buy from? What grocery store is safe to eat from? You know, which water can I drink from? Can I give my dog? Can I buy my dog certain foods? That's my reality. And if you say, oh, they know who has the ability to rig your food if it's sealed? Oh, honey boo boo. You know, when someone wants someone gone, all they have to do is pull a few strings, friends, you know. It's when you carry a mission on your heart in the light of God and goodness and grace and humility. Like I said, they crucified a perfectly normal man. How many years ago? I'm not Christ, but like I am a Christian. I identify as a Judeo-Christian. So I got the short end of the stick, essentially. I followed the rules. I did everything right in my life. And I nearly almost got brutally almost murdered because of it. So we'll see what happens. But if I do end up croaking, by the way, I'm not trying to make a joke out of it, but you know, we all will pass away eventually. Just know that it's not because I'm on my own accord, because I'm not taking myself out. I don't believe in that. That's like the worst thing you could do. Is the ultimate sin is taking your own life. And there's people who literally would give anything to be able to have a normal life. Anything. And so it's almost like I think, okay, let's take her life in lieu of whatever, you know. So, not that, I mean, I don't have that many people following me on this thing anyways, but I think people would know that, oh, she was talking about like targeting and gangstalking thing, and you know, people weren't helping her, so why did no one help her? Usually sometimes if it's like trafficking and stuff, or if it's money involved, a lot of people won't. If it's a large lump sum of money, because I do read cards and stuff, and my readings keep mentioning about, because that is a part of my life, is spirituality, and I got into card reading like, I don't know, when did I get into card reading? Like a few years ago, and it's really helped me kind of give clarity to things, because the thing is, I always say energy doesn't lie, people do, because this reads energy, right? And so what keeps coming out for me is that is a gift. You know, some gift. It does have to do with a large lump sum amount of money or something, and I don't know anything about that. No one's told me anything specifically, but it does come out on several occasions. So, but yeah, so we'll see, you know. If the powers that be are kind enough, you know, to say, hey, we'll let you, you know, live a few more days or months or years, then great. But also too, you know, I have to, oh look, thief gift. See, someone tried to steal a gift, I guess. That's what comes out a lot. Someone was trying to steal something that someone wanted to give to me, or I don't know what that's for, but that's what keeps, and that would make a lot more sense in terms of gang stalking and why people are provoking me. And I'm not going to say what came out, because I'm not going to out people like that, because that's the same person keeps coming out over and over again that stole something that belonged to me. Can't do anything about it. So anyways, I hope, I would like to live through this hot mess of a situation. No, I don't consider marriage a way out of that, because that's a very sacred sacrament. Matrimony is a sacred, I was raised Catholic, and I know some women go, oh, but that would be, yeah, but you don't know who you're marrying, and you don't know who what he's about. And and I have unfortunately encountered men who, I have been in compromised situations where my safety was like threatened. I've been in cars and where like I've experienced weird stuff, in the car, where I felt like I was suffocating or I was gonna faint or something. So yeah, but I'm hopeful. I'm a very instead of a hopeless romantic, I'm a hopeful optimist. And I know you would say, well, you're going through something really hard right now, and how do you stay sane? I choose happiness, because I've seen the good parts of life. I had a beautiful life before all this shit happened. So if someone tries to say you deserve to be sad, and I want you to be sad, and I want you to be miserable, you have no money, you're broke, and I go, but I'm rich in spirit. I honor a God that I've been blessed to witness firsthand miracles, because I'm not kidding when I say I think I've walked into clouds of rooms before where I literally I almost died. Like my breath was I couldn't breathe. I started to lose consciousness at a really rapid rate, because that's oxygen deprivation, and it's a blessing. So I push forward, and that's what you do when you care about the world around you and the planet and everyone in it. You put your life before, you give your life to something greater than yourself. And I'm not a soldier. I've never been in the military, but I look at it like that, because people are not things to be bought and sold. Humans matter. Animals matter. The truth matters. I matter, and I have always been the kind of person where I never wanted to stand up for myself, and I get to do that on this kind of platform, which thank God for YouTube. But I have an immense amount of faith. And one day I could suffocate. One day I could lose the ability to breathe and or walk. How many times I feel like I've been poisoned with possibly mercury or cyanide or thallium, and that causes lower extremity muscle impairment and muscular, degeneration, and osteomalacia, which is basically the softening of the bones, or maybe osteoporosis. So I will myself to move forward. That's all we can do. And I don't know what your plight is. I don't know what, everyone's going through something hard. Everybody. But you can choose to, there's a song, my hype song is whenever I feel really down, or like I feel like giving up just because I'm like, oh, I'm never gonna get out of this. If I'm in some targeting thing, I'm never gonna get out of it, right? I listen to, and it's so funny because you would think that I don't listen to that kind of music, but I respect him as an artist because he is very eloquent with his words, and I think the message that he tries to convey is very clear, and he's been through a lot of shit, and the song is whacked out, I think it's Whacked Out Murals, because people literally, you know, by Kendrick Lamar, so whenever I listen to that and I'm like, I want to give up, and he says, yeah, whatever, going up your rank, know you a god, even when they say you ain't, let your feelings out the way, don't let no one put smut up on your name, yeah, keep your head down and work like I do, but understand everybody ain't gonna like you. If they say, yeah, whatever, if they say it's love, you've been lied to. A couple rules of engagement, I'm gonna guide you. And I hear that, and I get myself out of bed, and I go, Ashley, you have to try again. And people are gonna be fake with you, and they're gonna lie to you. But you have to make sure that under no circumstances, you do not turn into them. Because when people go low, you have to go high. And it's hard. It's really hard, because you will walk that path alone. When you stand up for something greater and you're a good person and you do the right thing and you have ethics and you have morals in a world that's riddled with inauthenticity and superficiality, you will most likely walk alone. And when you want someone to take your hand and extend your hand out and say, hey, I need your help. I mean, I applied to the FBI to work as a special agent, and I took that very seriously. That wasn't a joke to me. To be considered one of the elite in law enforcement is like a gift and a privilege. But what I find now is like more than ever is that when push comes to shove, when you put your nose to the ground and to the grind, when people really are called to action to do what they know is right, how many people downplay that? How many people, you know, sweep things under the rug because for the fear of losing a job or getting ridiculed or being killed. I'm not even in law enforcement, and I feel like there's a target on my back. Go figure. So imagine the individuals who have to make those hard decisions of, you know, which is maybe why God's like, I'm not going to have you work in that field because, you know. But I do believe in integrity. I do believe in honesty and ethics. And if that gets me killed, then, you know, at least I tried, and I've lived 34 beautiful years of my life, and I hope to live a lot more than that. And I hope to one day be able to look back on this whole situation and say, you know what, I went through fucking hell, and my life got destroyed in the process. Everything that I held near and dear to me. I always say, you know, people count cash, I count college credits. That's my that's my thing. I don't need a lot of money to be happy. If you give me just enough to survive and live off of, that's good enough for me. Health is wealth. Without health, you have nothing. You can be the richest person in the world, and you fall ill with some debilitating disease, it means nothing. Think about that. Imagine you get the richest person in the world. I don't know who the richest person in the world is, but imagine if they got diagnosed with some debilitating disease or terminal illness. That money becomes nothing, meaningless. It's like dust, because now that person can't enjoy it anymore because they're going to be spending their money trying to fight for their life. I'm fighting for my life, and I'm not sick. People want to put me in sickness. There's people who are fighting for their life that are sick. Just some food for thought. So, again, if you do know about my situation and you feel so inclined, I recognize that, you know, and this is where dating comes in. I know this is about the workforce and employment. Dating me is gonna be very hard for whoever does to decide to do that, because it comes with a lot of just chaos and confusion. But I remind myself that I'm lovable. I deserve to have a beautiful, wonderful, loving relationship with someone. Do I realize that, yeah, a hitman can come along and be like, oh, I'm totally smitten by you, and then I want to court you and take you on a squire you about, which is funny because that word is an anchorman, but I want to squire you about town and take you on a, that would be lovely. I would love that. But the reality is that I do have a target on my back. And it's not funny. And I need people to help me through that experience. Good versus evil, light versus dark. So, hey, baby. Hey, baby. So we shall see. Every day is different. But I do believe collectively as a whole, I have had people reach out to me and say that, I'm praying for you. There was a lady in Italy who, that was so cool. That was cool. There are good people out there. I don't ever underestimate the power of goodness and grace in God. Do I push that on people? No. I'm not gonna, you do you, whatever makes you happy. If you don't believe in God, whatever, as long as you're a nice person. You can be an atheist, but don't be an asshole. Just be a nice atheist person. I don't know how we would jive or get along, but I do believe that there's a higher power, But what I do know is that I don't deserve to be slowly poisoned or drugged or killed for, I don't even know what at this point. Because it's funny because you have people that are like so much worse than me, like drug dealers and like rapists and all this shit, and the person who's not bothering anybody gets treated like dirt the most. Go figure. So I pray to God that I'm guided towards, I don't know, freedom, justice, truth. So, yeah. We shall see. TBD, to be determined. For TBC, to be determined, to be continued. I don't know. TBA? I don't know. Isn't the tibia, that makes me think of the tibia. Maybe someone's tibia is relevant. That's cool. I always think the tibia and the fibia. No, is the tibia bone the arm bone? No, isn't the femur. The femur's the large one. The tibia. Maybe my tibia is affected by something. I honestly, I'm going to be quite frank with people. I'll be quite frank. I actually thought that because of all maybe heavy metals and stuff that I've been exposed to, that I could have like bone cancer or like osteosarcoma or something for some reason. Because I don't know why I said tibia. This is relevant for somebody or for me. It's the shin bone. Because the femur is the largest bone. And then you have the tibia. So, yeah. So, but, don't be afraid to stand up for what's right. I think in the long run, God will bless you tenfold. You may not have money, you may not get super rich or anything, but I think you'll have divine supernatural favor where other people wouldn't. So, I don't know. Because you could, if you have supernatural favor and divine protection, you could always bounce back from adversity, so. I hope that helps somebody. God bless. Peace. And I'm going to do part 2 in a second. Where's my notebook? I'm going to try to make it short because this is so long. It's 2 hours, 48 minutes. So I'm going to wrap that up, put a little bow on it, and send it off to the interweb ethers. So, yeah.